Good afternoon, everyone. My name is Kelly McMillan. I am the Senior Vice President for Government Community Relations for Westchester Medical Center Health Network. And I am here today with the man who's really put all the time and effort into this activity. Dr. Etienne, do you want to introduce yourself?
Yes, Mel Etienne. I'm the Vice Chancellor for Diversity and Inclusion here at New York Medical College, and also a proud alum from the class of 2002.
And we really appreciate all you taking the time to come help us celebrate Women's History Month by learning and hearing from our women leaders in healthcare and academia. And we have some of the best and the brightest here with us today. We're excited to hear from all of them. And the panels will start shortly, and we'll be introducing you to them all. So I think we're going to try to keep this on time and keep all of our panels very focused. So we hope you enjoy the program.
Yes, absolutely. And I know Dr. Halpern's not here today, but I know if he was, I'll plug in for him. He's very proud of our history at New York Medical College, particularly always speaking about, he's got me speaking about it too, the fact that after NYMC was founded in 1860, we know that in the 1860s, NYMC did start admitting women into our medical school, when this was something that was unheard of in most parts of the country. So we're very proud of that. I think this gives us a good opportunity to both celebrate the rich history of women leadership, women's input. And I know one of the nice things we think about is that movie called Hidden Figures, where they showed you how women throughout history have had tremendous impacts, always contributing from the Revolutionary War to the present. Always have had a significant impact, often overlooked, but we want to make sure that we do take the time to celebrate all that here today and to recognize those things. I know that Dr. Nadler is on Zoom, and he wanted to give a brief welcome to everyone. So Dr. Nadler, if you are there, are we able to pull Dr. Nadler in? We'll have Dr. Nadler give brief remarks. After Dr. Nadler's remarks, the way we've set up the session today is we have 3 panel discussions, a chair's panel, a dean's panel, and an executive's panel. And right before each of those panels, we'll be sharing a poster of a woman from NYMC/WMC history who has had an impact in that particular area. So somebody who has been a chair, somebody who has been a dean, and somebody who has been an executive at NYMC and WMC, show what their impact was. And that will be presented by a student. Our students from the Women in Medicines group and the AMWA, which is American Medical Women's Association, will be presenting those posters. And those posters will be adorned in our halls. So one of the things we want to make sure of always is, if you want to recognize the impact, recognize the history, is actually showing those images so that our current students, our current faculty, our current staff can actually be able to see the impact that everyone has had on our community. So I see Dr. Nadler there. Let me get out of his way. Dr. Nadler, the floor is yours.
All right. Thank you, Dr. Etienne, and I thank all the organizers and the many panelists for coming together for this very special day. Dr. Etienne gave a wonderful history of why we're so proud of New York Medical College, its legacy of support of women. And if you just walk the halls on your way and in sunshine, you'll see how many of the women in the history of New York Medical College have made impacts, not just locally, but nationally and internationally. And so as Dr. Etienne said, Dr. Halpern's not here, but there's such a rich history here at New York Medical College of supporting women. And I'm so honored and proud to be a small part of New York Medical College and work with all of you. My comments are not only to say and to recognize the history, but also to recognize the people that are here, the people of the panel, the people they're going to talk to, and the mentorship, in that you're all making history today and the history you're making today will be very important for tomorrow. While we are very proud of our history, we can't rest comfortably. There clearly are many areas of improvement needed in terms of bringing women in academia and in medicine for equity in terms of positions and leadership positions, and also compensation. And mentorship and leadership is very, very important. That's why I'm so proud at New York Medical College to have so many deans and leaders who are wonderful leaders and mentors that could lead the next generation. But we shouldn't rest comfortably. We need to do more. One thing I'd like to see at New York Medical College, more women in leadership positions, as well as endowed chairs for women leaders in our chairs and future deans. So this is a wonderful event. One of the things that Dr. Etienne had, he had a little trouble actually, because we have so many wonderful women leaders that in all respects, but this is so important. What I would say the most important thing is having mentorship. And we're very proud here at New York Medical College and the people that are participating in this panel of how this is important of leading the history moving forward and taking our legacy and helping the next generation. So I want to thank everyone involved, and I'm looking forward to hearing the wonderful comments and input from the panels. Thank you very much.
Thank you, Dr. Nadler, for those wonderful remarks. I also want to thank you for getting me off the hook for all the women I didn't invite to be on the panel, because we did have a large number of women. I had trouble figuring out like who do I bring. But we tried to get people representative of certain aspects of the school, and believe me, all those of you who weren't invited to be on the panel, I'm sure you all would make great panelists as well. So yeah, and thank you, Dr. Nadler, for that part of your talk. So as promised, we're going to go into our first poster presentation. One of our medical students, Maida Reddy, will be presenting a poster on Dr. Lilik, who is known for being, among many things, the first woman, I suspect she's even the first person, to be a chair of a basic science department, which was microbiology here at NYMC, and attend medical school at the same time. So that's a very rare feat. I haven't heard of anybody else doing that. But Maida Reddy is going to present that poster.
Good afternoon. I'm Maida Reddy, a member of the class of 2024 at New York Medical College and a member of AMWA, the American Medical Women's Association. Today, I'm here to unveil a poster honoring Dr. Louis Lilik, the chair of the Department of Microbiology from 1946 to 1962, and the only person to receive an MD from our college while already chairing one of its basic science departments. After completing a PhD in microbiology, Dr. Lilik worked as a postdoctoral researcher at the Woods Hole Oceanographic Institute. Her research there is now recognized as having laid the groundwork for modern plankton ecology. Unable to secure a professorship in her original field, Dr. Lilik joined the Department of Microbiology at New York Medical College in 1940. She rose rapidly through the ranks of the department. In 1946, she was appointed acting chair, but her lack of deep medical knowledge prevented her appointment as a full chair. This problem was resolved in 1953 when she graduated at the top of her class as an MD student and was immediately named full chair of her department. She remained in this position until 1962. After leaving the college, Dr. Lilik received her MPH from the University of California, Berkeley, and joined the California Department of Public Health, where she rose to the position of deputy director. Here, she led the fight for the inclusion of home care services in Medicare and Medicaid coverage. Dr. Lilik's passing in 1976, the California State Association for Home Care Professionals established an outstanding leadership award in her memory.
We also have some brief remarks from Dr. Sasik, who is somebody who works where Dr. Lilik was working.
Hello, my name is Heidi Sasik. I am a senior scientist at the Woods Hole Oceanographic Institution, where I study the ecology of plankton. Plankton are microscopic life forms that live everywhere in the sea and have big effects on everything from food webs and productivity to nutrient cycles and global climate. It is such a pleasure to be a small part of this celebration of the many accomplishments of Lois Lilek. Her work has influenced me and many others in the ocean sciences. As a student of botany at the University of Michigan in the 1930s, Lois somehow ended up in a kind of internship in the small village of Woods Hole, Massachusetts, where she began studying the photosynthetic plankton in ocean waters off the Northeast US. This was well before women were even allowed to join ocean-going fieldwork, so Lois worked from samples collected by others. With detailed microscopy, she identified and counted diverse species and described their patterns of response to environmental conditions like temperature as they change with seasons and from place to place in the ocean. She authored a series of publications, including her 1938 PhD thesis on this topic. Lois Lilek's pioneering work on marine plankton helped set the foundation for long-standing paradigms in my field. Her results influenced others and inspired quantitative research and mathematical modeling approaches that have profoundly shaped the field of biological oceanography. It's really so wonderful to know that Lois Lilek's incredible legacy is getting such well-deserved attention. Thank you all.
All right, thank you, Dr. Sasik, for sending those remarks. We're going to now go into our first panel. The first panel is entitled Changing the Tone Through Leadership. This is a panel which will consist of women who are chairs at NYMC and WMC. The moderator of the panel is our wonderful and my chair of neurology, Dr. Tracy Milligan. Dr. Milligan is a professor and chair, Department of Neurology at NYMC, director of neurology, WMCHealth, came to us from Harvard University, where she was program director for the Partners Neurology Residency Program. And she will lead us through this panel. Dr. Milligan.
Thank you, and thank you very much for inviting me to moderate this panel. It's just a wonderful day to celebrate accomplishments and to come together like this. I'd like to invite our panelists who are here in person to come and sit at the table. And we have one panelist who joins us on the screen, and we'll have another who might be joining us later. So as they come to the table, I'd like to introduce our three panelists who are here and our fourth panelist who may be able to join us later. First, I'd like to introduce Dr. Lori Solomon. Dr. Solomon is chair of the Department of Family and Community Medicine and director of the NYMC Family Health Center. She earned her medical doctorate and Master of Public Health from New York Medical College. She completed her residency in family medicine at Brown University, where she was chief resident. She has extensive experience in developing community teaching sites and has been active in the establishment of a longitudinally integrated clerkship and in curriculum redesign at New York Medical College. Her desire to improve patients' healthcare experience and health outcomes inspired her to start a new family medicine practice at New York Medical College, which is co-located with the dental clinic at Truro College of Dental Medicine. She loves helping her patients adopt healthy lifestyles through all phases of life. She's worked for the National Board of Medical Examiners, developing questions on ambulatory care for steps 2 and 3 of the USMLE licensing exam, and serves on the leadership committee for the Association of Departments of Family Medicine, and is a delegate to the American Academy of Family Physicians National Congress of Constituency Leaders. Her interests include improving clinical practice models, leadership development, especially among underrepresented groups, mentorship, and longitudinal skill development. She is a member of the Alpha Omega Alpha and was named a 2022 Healthcare Hero by Westchester Magazine. Thank you for joining us, Dr. Solomon. I'd like, as I continue my introductions, thank you. As I continue the introductions, I think you will see some of the characteristics we heard about with Dr. Lilick in each of our panel discussants. Such a wonderful group. I next like to introduce Dr. Hutchison. Dr. Kelly Hutchison, professor of ophthalmology, serves as chair of the Department of Ophthalmology at New York Medical College and director of ophthalmology at Westchester Medical Center Health Network. Dr. Hutchison received specialty training in pediatric ophthalmology at Emory University. She obtained her medical degree with honors from University of Virginia. She also holds a master's degree in business administration from George Washington University. She is a member of Alpha Omega Alpha Medical Honor Society. Dr. Hutchison served as chief of ophthalmology at Sidra Medical and Research Center and Weill Cornell School of Medicine in Qatar. While there, she led a team to perform medical and surgical outreach in the Dominican Republic. She also led a medical trip to Ethiopia in partnership with Surgical Eye Expeditions International to provide medical and surgical care. Prior to that, she directed the fellowship research program in the Division of Pediatric Ophthalmology at the Children's National Medical Center in Washington, D.C. There, she developed and led the novel program, the Surgical Humanitarian Outreach Center, to provide support and fellowship training of surgical and anesthesia delivery in developing countries. For over a decade, she has been the president of a charity organization that delivers surgical eye care in the developing world. Welcome, Dr. Hutchison. I'd like to turn to the monitor now to introduce Dr. Michal Schwartzman. Dr. Schwartzman is professor and chair of the Department of Pharmacology at New York Medical College. Dr. Schwartzman obtained her PhD from Tel Aviv University in 1981. She joined the pharmacology department at New York Medical College at 1981 as postdoctoral fellow on an NIH Fogarty Fellowship and rose to the rank of full professor in 1993. She is a nationally and internationally recognized for her research, which focuses on the role of lipid mediators, primarily 20-HEDI, in the regulation of vascular function, inflammation, and metabolism in the areas of cardiovascular and metabolic diseases. The chemical structure, biological function, and mechanism of action of some of these lipids have been identified in Dr. Schwartzman laboratory. The culmination of her research has been the discovery of the 20-HEDI receptor, namely the GPR75, which was recently identified as an obesity gene. She continues this important work using translational research techniques of gene targeting, transgenic animals, and human material. She published more than 250 manuscripts in peer-reviewed journals, including Nature, Science, PNAS, JCI, and Circulation Research. Dr. Schwartzman is a recipient of numerous awards, including the Dean's Distinguished Research Award, and has held continuous NIH funding since 1981. Dr. Schwartzman has served as a member of the NIH study sections, NIH review panels, and journal editorial boards. She is currently the editor-in-chief of the journal Prostaglandins and Other Lipid Mediators. Thank you for joining us, Dr. Schwartzman. I'd lastly like to introduce our panelist, who is a surgeon and also in the operating room. So we hope that she'll be joining us. And even if she can't join us, I think you'll be inspired by hearing about her. Dr. Ashanda St. Jean is Chair of Obstetrics and Gynecology at Health Alliance Hospitals of Westchester Medical Center Health Network, an Associate Professor in Department of Obstetrics and Gynecology at New York Medical College. She is a graduate of the Sophie Davis School of Biomedical Engineering, Biomedical Education, CUNY Medical School. She later received her doctorate in medicine from New York Medical College. She completed residency training at Danbury Hospital, Yale, New Haven affiliate in Danbury, Connecticut. She previously worked at Columbia University Medical Center, New York Presbyterian Hospital, where for 14 years, she was the director of outpatient OBGYN services for the Ambulatory Care Network. She has a wealth of experience in New York City focused on the delivery of quality care to underrepresented minority women. Her life's work has been in the education and healthcare of underrepresented and delivering excellent patient care through comprehensive care, inclusive of mental health and well-being. She is committed to women's health issues, most importantly, focused on racial disparities, health equity and inclusion, maternal health safety, maternal health policy and access, the role of telemedicine in maternal health and teen pregnancy. Dr. St. Jean is a champion for patient advocacy, midwifery and doula care, breastfeeding, lactation awareness, diversity, equity, and inclusion. And we're happy to have Dr. St. Jean honored as a member of this panel. Wonderful, she joined us. Welcome, Dr. St. Jean. Thank you.
Thank you so much. I apologize for the delay. I was in the OR, so I quickly finished. Everyone is safe, but I'm so happy to be here. Thank you.
Thank you. And I hope you appreciated the so many inspiring accomplishments of our women leaders on this panel. I'd like to turn to each of them now. And you know, it's been said, managers do things right. Leaders do the right thing. And I'd like to ask each of our panelists to say, what principles do you use in guiding your leadership? Dr. Solomon, would you like to take that first?
That one was a little bit of a curveball, but what principles guide my leadership? I think that the most important thing is to really know what you want to do and where you want to go, and to be able to communicate your vision with respect, and also with being able to listen to what other people are saying, and to look around and see how, am I not getting, oh, okay, I'll try again. Can you hear me now? Okay, all right. I'm not sure what everyone on the call heard, but what I would say is that one of the things that guides me is not only do you need to have a vision for where you want to go, but you also need to be able to listen, to hear people, to look around and see what's going on, and to change that vision or modify it slightly if you need to. I also think that a guiding principle is inclusion. So making sure that that multiple people's perspectives are seen and heard and respected when you're communicating visions, but also when you're communicating with the people who are above you in determining overall strategy.
Thank you, Dr. Solomon. Dr. Hutchison, how would you answer that question? And I know you've had challenges in your work. We heard a lot about your work. What principles do you use as you're navigating your leadership role?
You mentioned in my introduction that I went to business school, and I did go to business school while I was already a practicing physician. I had been out for many years. And the most important thing that I learned in business school was not about finance or accounting. It was about leadership. And it was also about organizational dynamics. But in leadership, I learned the most valuable lessons. And one of the books that we read was John C. Maxwell, The Fundamental Laws of Leadership. And something stuck with me, and I have never forgotten it. And it is that the job of a leader is to serve. And I try to look at my job that way every day. Hopefully the people who are in my department or sitting in the audience will back me up on that. But I like to look at it as, what can I do to help everyone in our group reach their own highest level? And what can I do to help this group be successful?
Thank you. Dr. Schwartzman, could you share with us the principles, the values that you use in guiding your leadership?
So actually, it's 3 words: listen, respect the others, and work as a team to better the environment. And that's what I did from the beginning. I always respect the environment that I am in. I learn from the people who are my supervisor, and I transmit this learning to the one that I serve. Important feature. Without it, we cannot move forward, to listen to everybody that we are interact with and respect them. And at least in my department, I really advanced the department by forcing or actually instituting or encouraging a sort of a teamwork. And that's how we succeed as a department. It's not only my leadership, it's the way that I instill the better good of the department in each of the faculty member in our place.
Thank you, Dr. Schwartzman. Dr. St. Jean, share with us your thoughts on the principles and values that you hold close as a leader.
Well, I would say one of the first and true principles is empathy. I think there is an aspect of leadership where you have to have empathy for those on your team and for others. And as one of the other panelists spoke about, is service. And so as a leader, I think you have an opportunity to be of service to not only our patients, because we're clinicians, but also to those that we work with. And so creating this circle of safety, this zone of safety where everyone's voice is heard and validated, but also they are a participant in how successful the team can prosper. So I think that there is a very, very careful dynamic that must play where we make sure that everyone who's part of the team, because this is where you're going to be more successful, is that if everyone feels validated and feel they're an important part of the team. So I think that it's creating that circle of safety amongst your team members, but also leading with empathy. There's another very great book, which is called Leaders Eat Last. So it's leading by example, but also understanding the importance and the value of every member of the team and making sure that they acknowledge that you see that in them. And so there's an acknowledgement that they're validated, that they're seen, they're heard, and that they understand that they're an important part. So no matter what role they play, that they're an important member of the team. And that will truly go forth with success and kind of prosperity of a team.
Thank you very much, Dr. St. Jean. So I think that probably I share the sentiments of our entire audience in saying, if there's a need for change of tone, I want you all to come and change the tone. I'm ready to follow. So with the topic being changing the tone as a leader, I'm going to open it up to our panelists. If they have a specific example that they would like to share with the group about their thoughts on changing the tone through their leadership, through the specific values, principles, or maybe some specific situations that they've been part of, where coming in as a leader, They've needed to either really strongly set the tone or change the tone. And as I pose that question to our panel, I want to invite the audience, that we want to have some audience participation. It's just a wonderful opportunity to ask our panelists specific discussions. So have your own questions prepared, and we'd like to have you share those. So I posed another challenging one to the panelists, to really think about a time when they may have needed to change the tone of leadership or really set a very strong tone that follows their values and principles. Is there somebody on our panel who would like to start with that question, start answering that question? Dr. Hutchison?
Oh.
So is this one working? Okay. Okay. When I worked overseas, I had an interesting environment because I worked in a hospital that had people from 128 different countries. And you can imagine lots of different ways of doing things and different languages even. So it was very important in the beginning to establish a single way that we were all going to communicate together, and a single way that everybody would participate on the team. And also making sure that, as you mentioned, or as our last speaker mentioned, that every single person on the team knew that they had a valuable role to play, because the team wouldn't function at its highest level if even one piece wasn't there. So getting everybody to come together and then establishing that uniformity of process, of communication, and having everybody feel the same pride in the outcome or the product, which was our patient care. Thank you.
Thank you. That sounds like a particularly challenging situation.
It was a lot of fun.
I wanted to add, I would say after the majority of my career working in New York City, I moved upstate to Kingston, and where I'm the chair at Health Alliance, which is part of Westchester Medical Center Network. And when I came, I first had to do an evaluation, kind of a needs assessment, to kind of just see what is needed and how I can improve and enhance quality of care to this population of Ulster County. And so one of the things that I did was, in navigating this role and this pathway, was seeing how we can all kind of meet on the same page. And one of the things that I focused on was education, quality of care, and also kind of making sure we kind of uniformly have a patient-centered approach. And so again, change is not always easy. It's not always accepted. Change can bring forth a lot of challenges. There are barriers to change. But I think that we have to have a vision, a goal, and kind of putting the patient first. That was how I was able to unify my team in kind of creating this level of excellence and kind of improving quality measures and standardization and best practices that would kind of enhance the patient experience. Unfortunately, we've been living through this COVID pandemic, and so we understand that there's heightened stress for everyone, team members, for the patients, there's restrictions on visitation. So there's a lot of challenges. And I think this is where empathy, compassion, thoughtfulness comes in, because again, we want to be our best for the patients under not ideal situations, but we want to make sure they have the best outcomes. And so these were very difficult trials for me in the beginning, kind of getting buy-in. So identifying our stakeholders and seeing that they understood the vision was to make sure our patients receive quality care and excellence. And so I think it was through that vision that we all kind of unified, and we've come together as a department to kind of make sure that we have standards and have, debriefings after difficult cases and opportunities to discuss improvement. Because I think that what we can do is hear everyone, because there's a different take and a different perspective. And that always gives us opportunity for growth.
Thank you, Dr. St. Jean. It's so interesting to hear the examples so far and to think about how they very specifically use the values that they discussed in navigating these really challenging situations. Dr. Solomon, what are your thoughts on this?
So one of the things that comes to my mind around thinking about this is when I opened up the Family Health Center, actually way before that, when Touro College of Dental Medicine first started, I think there was some push and pull between the medical school and the dental school in terms of just resources and what does that mean, and I think that there was some divide. And one of the things that I found was I saw it as a tremendous opportunity for the medical school to strengthen its teaching and also to strengthen the health of our community. So when I was looking to open up the Family Health Center, I was like, this is a wonderful opportunity. I can pair with the dental school and we can do really wonderful things in the community. And so so a lot of times I changed the tone of the conversation from this is a drain on a resource or we're struggling for the same things to no, if we're together, we're stronger. We can build things that we'll never be able to do on our own. And so, I just kept saying this and finding, I found the people that were supportive of this idea. And then there were some people that were actually not so supportive. But the more we chipped away and the more we talked about it and the more that we, that we explained this vision, the more buy-in we got from from other groups. And now, we're to the point now where we are so much stronger together than we ever would have been. And the opportunities for student education, we have dental students and medical students, doing free clinics at the Family Health Center and the dental clinic. It's really a wonderful opportunity. And so it really took changing the conversation from what are we taking away from each other to what can we build together.
Thank you.
I have a comment on that also.
Yes, I'd like to hear Dr. Hutchison's comment, and then I'm going to ask Dr. Schwartzman to comment on some things. So Dr. Hutchison, please.
Just on a follow on that, we also sometimes have some tensions because as the previous speaker mentioned, we've all been through a lot. It's sometimes difficult for us to get along with each other. And when you talk about changing the tone, I think it's really important to get in there right away and not wait for things to fester. And then, as you were saying, Lori, to change it to a conversation of how can we all work together, recognizing that we are better together and bigger together than we are by ourselves. But I think it's just important not to wait.
Thank you. And a perfect segue to what I was going to ask Dr. Schwartzman, who has many leadership activities, but I mentioned to you that she also has been part of leading NIH study sections and leading people from different parts of the country and trying to set the tone in the right way. And I'm sure that's really easy to do, Dr. Schwartzman. No problems there. But maybe you can tell us a little bit about your perspective on changing the tone through your leadership.
So yes, I'm coming from a very different background as the other panel on this panel. And, I'm an academician into a position with
Dr. Schwartzman, yes. I'm just going to let you know that your audio is cutting out a bit.
You hear me now?
We can. Yes, we can. Just to let you know, it's cutting out a bit.
I'm sorry. I'm a little bit far away from you guys, so it's okay. So what I wanted to say is that I'm really different from the other wonderful panelists of this panel. I'm just a scientist who grew up into the leadership position within the department from almost like a postdoc. It's right after graduation. So my way of going up the ladder was probably a little began when I just entered the chairmanship position at the Department of Pharmacology, the department was really, in a sort, I will say, broken. The morale was very low. Funding, NIH funding, was also critical, in a critical level. This is when I stepped in. I put all my effort in bringing together all the department, saying that our fate, our future is being together, and pull all the resources that we have, all actual resources that we have together. And that's the only way that we can push forward. And with that, we got a huge NIH, it's called the Program Project Grant, which is a couple of $1 million a year. For that, it's not only for one investigator, but it was for 6 investigators in the department. And that's pushed us forward. We could recruit more faculty members and really better the department. So this is really a lot of a teamwork. I was leading the team, but it was an amazing transition.
Thank you.
And in the study section, I can just say that when I was in the study section, so I'm going back 20, 30 years ago, study section, 25, 30 people. Among them, there was maybe 1 or 2 female women. That's it. So you were 2 among 30, and you had to really work hard to show the value of a women scientist that have a different perspective when they review grants than male counterpart. And that's a very, very difficult position to be, but I think that we succeed. If you look today on a study section at the NIH, there are many more women scientists from all different backgrounds, which is...
Oh, we lost the audio, but I will say at the very end, we just lost the audio, but the principles are so similar of really coming together around a shared goal and finding similarities. I want to turn it to the audience now to see if there are specific questions for our panelists. And we have a question that came in over the chat. So let me start with this one. Good communication skills are often referred to as our ability to speak well and write or present well. What other forms of communication skills did you need to develop to move forward as a successful leader? Were there other skills that you needed to develop that were not emphasized earlier in your careers? Thank you so much for that question. I'll turn that question over to our panelists. And whoever would like to comment.
I would say the development of emotional intelligence. I think that is key, especially as a leader. You know, sometimes you are putting out a lot of fires, and you know, sometimes there are complaints that are emotionally driven, or there are situations that are emotionally driven. And so what you want to do is, you know, be able to maintain your posture. And so when you talked about different levels of communication, there's also body language, there's facial expressions, there's tone, there's delivery. So I think that it's a accumulation of all those things that you have to put forth in order to de-escalate a situation, but also make sure that it is a respectful communication, and that everyone is heard, and that there's a validation, but also that there's an understanding that we must arrive with the same vision. And sometimes that's done through different modalities. So I think emotional intelligence is key.
Thank you, Dr. St. Jean. Dr. Hutchison?
think it's obviously also very important to be a good listener. Laura, you mentioned that in the beginning. And especially when you come into a new situation, or if there are people that you don't know very well, you need to listen and find out who they are and what they need and how they're going to be able to fit in. So listening is important. The other thing that I mention often in our department is it is very important to be aware of our body language. And we know that maybe 80 or 90% of communication, I think actually even more, is nonverbal. And so when we're stressed and tense, it shows. So I think having that external calm is very important. And if you can fake it until you make it a little bit, that's great. But the ultimate, I think, is to get that internal calm inside ourselves and realize that these work stressors are like waves and they come and they go. But ultimately, we're going to figure it out. We're going to work together. And if we have that equipoise, it comes from inside, it shows outside, other people kind of drink it in and they'll absorb whatever energy we each are radiating. So, yeah.
Thank you. What a specific example of how to really set the tone through something other than the verbal communication. Thank you. Dr. Solomon?
One of the things that I don't think we talk too much about in terms of communication is who to communicate to and when. And those are really big lessons. And I think that those are lessons I'm still learning as a new chair. But you have to communicate with, you have to figure out who you need to talk to. Sometimes when there's an issue that comes up, it's like, oh, what do I do with this, or who do I talk to? And your first instinct may be to like go to the head person, but sometimes you have to actually do some of the groundwork first, find out, flesh it out, and then say, okay, well, all right, I thought I was going to go to this person, but I really need to, in order to come up with a solution, I needed to talk to these other people. And so it's important that you know who to talk to and when to talk to them. Sometimes if you go prematurely to somebody above you without a clear picture and without a solution, it just sounds like whining and complaining. And so I generally try to actually at least have somewhat of a solution in my head before I present something. And I've actually explored the problem. And the other thing is, I think I'm probably not so good at this. And I think a lot of women leaders struggle with this, is communicating your successes and communicating the things that you've done to other people. It is really important to share those things, to celebrate those things. You celebrate with the team, the people that helped you, and you also share it with the rest of the world. And I think that's just as important, so that people know what you're doing and what you've done.
Thank you. And if there's a question in the audience, just raise your hand. We'll bring the mic over to you.
If I may add one other thing in regards to communication, a mentor of mine very early in my career counseled me to just really be careful in terms of your email communication. In terms of your timing, the tone that may be in the email. So you want to make sure that, again, it's not emotionally driven. And often when you do leadership courses, there is a tremendous amount of time that's spent on conflict resolution, but also negotiations. And you want to refrain from sending out emotionally driven communication. So emails, you want to be very mindful of who is on the email, who is CC'd, and kind of where that email may travel to with whatever tone or delivery it has. So those are key things that you want to think about as a leader, but just as a better communicator.
Thank you, Dr. St. Jean, for such wise words around email. And if only we learned these things before we did the mistake or made the mistake. I did read something recently. It said, never put the addressee in first. Write the email and then spend the most time on that to box. So thank you. We have a question?
Mike. You know, one of the things so remarkable about the panel, all the panelists, is all the hats you're wearing. And I know Dr. Schwartzman is a researcher, and then the rest of you are clinicians, and trying to keep up on your clinical acumen and your expertise, and keeping all the literature in mind, and all the professional development that goes into that. But on the other hand, you have these leadership roles. And I was just wondering if you could share something about your activities or practices related to continuing to develop yourselves as leaders.
So I will say that I am fortunate in our Department of Obstetrics and Gynecology out of Westchester Medical Center is our chair, Dr. Tedra Hadi, has created a leadership development course for all of the leaders in all of the divisions within OBGYN. And that has been tremendously helpful in navigating difficult situations, but also allowing us to have the camaraderie of all these division leaders to kind of be able to talk to each other and also kind of vent, but also problem solve. There's so many, opportunities that we can help each other or different ideas. And so kind of being able to participate in a leadership academy, that is tremendously helpful, but also mentorship, and also having a community of leaders that you can fall back on and kind of discuss different ideas, and also get feedback as well.
Thank you. Thank you for that question and that response. I did hear that it has been shown that the very best leaders, a part of their leadership is helping others around them lead. And that's such a great example that you just shared. I do want to hear actually from the other panelists. How do you help, yourself develop your leadership skills? What are your activities around that? Dr. Solomon?
I kind of approach it a little bit like clinical CME in terms of you have to keep up to date, but you also have to reflect on your gaps. And so one of the things that I do clinically is I go, okay, you know what, I saw this case and, I didn't really feel like I knew that much. I need to go, bone up on this. Or I'll take our maintenance of certification. We have to take, we have to do test questions. And so I'll identify a gap. Same thing happens in leadership where things come up and I go, I could have done that better. I just didn't quite handle that as much as I wanted to. And so, it's about finding opportunities to figure out, to acquire those skills or to practice. Sometimes it's about talking to a mentor to kind of debrief something and say, well, how could I have done it differently? But then there are also more formal programs. And I've done a couple of fellowships, a leadership fellowship. And then in our, my specialty has a leadership, a chairs group. So we talk a lot about leadership, and we have an annual conference, and I go and we do a session where we just talk about the challenges of leadership and the things that and approaches where we can kind of discuss different approaches. So I'm always thinking about where do I need to. One of the things that I recently figured out was that to be a good leader, you need to have advocacy skills, which I don't have, I don't think that well. So one of the things that I'm doing is actually doing some advocacy on behalf of the American Academy of Family Physicians. So I'm going to learn by doing. And so I think that's one of the ways that I do it.
Thank you. Before we move to our other panelists, I think we are at our time, actually. But I do want to just highlight something Dr. Solomon said, because it fits in so well with what we learned about Dr. Lilik. Like Dr. Lilik was a scientist, like Dr. Schwartzman. That's how she started her career. But how did she end her career? It was with patient advocacy. And that's what the award in her honor is named for. And so that advocacy, I think you've heard from all of our panelists as well. Dr. Etienne is giving me a signal. We have time for another question. Is that the signal? All right, wonderful.
Okay, so I'll be quick. I just want to say that I am encouraged and inspired by all of the panelists on the panel today. And it's really not so much a question that I have, but I wanted to edit one of the quotes that you gave earlier. You said that managers do things right and leaders do the right thing. I will edit that by saying women in leadership have to do both.
Well said.
Awesome.
And before we conclude, well said, a round of applause for that comment for sure. But before we end our panelist discussion, this first part of our panelists, I looked up, I wanted to record the values of New York Medical College. I'm going to read those to you because I think part of these remarkable leaders you've heard from is the synergy of where they are and the pride that we should take in New York Medical College and our values of excellence, human dignity, intellectual curiosity, service, diversity and inclusion, and integrity. And so we've heard of Dr. Lilick, you heard from our 4 amazing panelists and all such inspiring women to honor on this special day. Thank you, Dr. Etienne, for bringing us as panel number 1. Thank you to the audience as well.
Thank you.
Thank you.
Thank you, Dr. Etienne, and thank you, Dr. Milligan.
Thank you, Dr. Milligan.
Thank you, Dr. Milligan, for that excellent job of moderating that first panel. Learned a lot, really, really wonderful. And I agree with those closing comments about women in leadership. That was just on point. Up here, you see the CME. For those of you who want to get CME, you're going to be learning a lot from these sessions over the next 3 hours. So definitely claim those continuing education credits. The other thing I did want to mention for this entire conference, this entire session, all the panelists, all the moderators, including me, we have no disclosures. We're not talking about any particular medications or devices or anything like that. So there's no conflicts of interest in this session. Next, we're going to have our next poster. And we're going to have one of our medical students, Soni Hussain, will be presenting a poster on Dr. Rabinoff. And Dr. Rabinoff was actually the head of the school that became basically the precursor to the School of Health Science and Practice.
Good afternoon. I'm Soni Hussain, a member of the class of 2024 at New York Medical College and a member of the Women in Medicine Initiative. I'm here to unveil a poster honoring Dr. Sophie Rabinoff, chair of the Department of Preventative Medicine, Public Health, and Industrial Hygiene from 1951 to 1956. This department was the predecessor of both the Department of Family and Community Medicine in the School of Medicine and of the School of Health Sciences and Practice. Dr. Rabinoff was born in 1889 to a Jewish family in Russia that emigrated to the United States when she was an infant. After receiving her MD in 1913, Dr. Rabinoff applied for an internship at Manhattan's Beth Israel Hospital. At first, she was rejected because she was a woman, but she convinced the hospital to allow her to take the admission exam and scored first out of 31 applicants. As a result, she joined the hospital's house staff as its first female member. She then became a resident at the New York Home for Infants, where she began her lifelong interest in childhood nutritional deficiencies. In 1918, Dr. Rabinoff was the only female physician to be part of the American Zionist Medical Unit in Palestine, where she organized a pediatric clinic at which children of all backgrounds could receive care. After returning to New York, Dr. Rabinoff joined the New York City Department of Health. By the time she joined the New York Medical College faculty in 1939, she was in charge of a public health district which included large areas of both East Harlem and the Bronx. In 1951, Dr. Rabinoff became a full professor and chair of her department, which she led until her retirement in 1956.
Thanks, Sonny, for that nice history on Dr. Rabinoff. Again, all the posters you're seeing here will be adorned in our halls. We're now going to the next panel discussion. The next moderator will be Dr. Marina Holtz. Dr. Holtz is the Dean of the Graduate School of Basic Medical Sciences and Professor of Cell Biology and Anatomy here at NYMC. Dr. Holtz, the name of this panel, as you all know, will be Making a Difference. Dr. Holtz.
Thank you very much. It's a great honor to be here and especially surrounded by my fellow panelists who are all amazing. And I'll ask you to come up to the panel. And I know we have some people joining online, correct? So while everybody is settling, the reason that I chose this theme for our panel, Making Difference, is because when I looked at the amazing women who were invited by Dr. Etienne to participate in this particular session, I really thought to myself how accomplished they all are. And they're successful clinicians and educators and public health officials, but they all participate in this mission of the college in education and leadership because they choose to. So they really choose to be here in this role as leaders and deans because they really want to make a difference. So why don't we start by introducing ourselves? A brief introduction, you can see that we have a lot of deans here, which is also very important. We'll talk about this. And I'll start, I know Dr. Etienne mentioned, my name is Marina Holtz. I'm the Dean of the Graduate School of Basic Medical Sciences here at New York Medical College. I'm also a professor of cell biology and anatomy, which means that I do research. I have an active lab that actually studies diseases of women, common diseases like breast cancer, and also rare diseases like a rare lung disease called lymphangiomyomatosis. So somehow I gravitated towards making a difference in women's health. But let's go and introduce our panel. Dr. Ludmer, see you're first here.
Thank you. Hi, I'm Pam Ludmer. I'm a Med Peds and Adolescent Medicine physician, Associate Dean for Curriculum Integration at the medical school. And I'll leave it at that. I think we can discuss as we go along.
Hi, everyone. I'm Jennifer Kessler. I, too, am trained in internal medicine and pediatrics. I'm the Senior Associate Dean for Medical Education and the School of Medicine.
Good afternoon. I'm Tatiana Cheers. I'm an assistant dean for PhD programs at the Graduate School of Basic Medical Sciences. I'm also an assistant professor of pathology, microbiology, and immunology. It's a pleasure to be here.
I agree. It is a significant pleasure to be here. I'm Amy Ansell. I'm an associate dean in the School of Health Sciences and Practice. I'm also a faculty member in the Department of Public Health and in the School of Medicine, Family Medicine. In addition, I'm Director of Community Outreach with the Children's Environmental Health Center of the Hudson Valley, which is an innovative project that really makes a difference, founded by our Dean Amler and Dr. Dozer. I'm the director of the APE program, which we place over more than 1,000 students in public health in the community, working with our health commissioner, who I think is here today. And with everything we do, and that's the only reason I'm mentioning it, I've put forth some of those key things that I'm doing.
Hi, I'm Pamela Casey. I'm the Associate Dean for Faculty Development. I'm also a professor in the departments of pharmacology and physiology.
Hi, I'm Jane Ponterio. I am the Senior Associate Dean for Student Affairs at New York Medical College. I'm also an Associate Professor in Obstetrics and Gynecology. I am also a graduate of the Sophie Davis program and an alumna of New York Medical College. And I am a women business owner of a partner in a private practice of obstetrics and gynecology.
Hello, I'm Catherine Stompnagel. I'm Senior Associate Dean of Faculty and Academic Affairs. I also oversee CME for the School of Medicine, and I'm Interim Vice Chancellor for Student Mental Health and Wellness. I'm an Associate Professor of Surgery, and I think that's why I'm sitting on the end here near the skeleton. We can talk later about that.
Thank you. So my first question will be to you, Dr. Kessler, and actually seeing all the women deans here really made me think about the conversation we had, the short conversation we had a couple of years ago when we're finding a place at a table, at a conference table at one of the leadership meetings here at New York Medical College. And all the women tended to gravitate towards one side of the table. And you told me, this is not a big deal because a few years ago, I was just an only woman here at the table. So what does it mean to you to be surrounded by so many deans, especially in your role as one of the most important figures for the School of Medicine curriculum, and setting that example for the junior women that come?
That's a great question. Thank you so much. I remember that conversation that we had, and it is wonderful to be surrounded by such strong, intelligent, inspirational women. I think that it's a long time coming. I think that what I've tried to do is surround myself with individuals who can inspire me, and hopefully I can inspire them a bit, and to provide role modeling for our faculty members, opportunities for our faculty members, and particularly our students really across the board.
Yeah, that's really important because just a few years ago, if we all think back, there are so few of us in leadership positions. And just to follow the panel of women chairs here at New York Medical College, and it's really inspiring to see so many. And my next question is to you, Dr. Spunknebel, in your position as the Senior Associate Dean for Faculty Affairs, you oversee recruitment of new faculty and new chairs. And how do you really ensure that qualified women apply and are encouraged to apply for these positions and are selected into the finalist roles and actually get the jobs that we open up for them?
That's a great question. And I think that I have to owe it to the leadership of the school for establishing a devoted Office of Faculty and Academic Affairs. So it really, from the inception of that office and myself overseeing that office, it created an opportunity to look at best practices and to do the kinds of things that Dr. Holtz mentions, one of which is opening your searches, targeting your searches to be inclusive. If we don't have women applicants or underrepresented applicants, you have no chance of having people in leadership. So there are best practices that exist. I've brought those best practices to the institution, and we make sure that those practices are followed to the T. And I think that on the front end of the recruiting and the experience that folks have when they come through for interviews, I think they feel how inclusive the process is. And we've really been successful in searches and bringing people to the institution.
Thank you. Do we have any questions from the audience to the people who spoke so far? Anyone online? People at home? My next question is to you, Dr. Chairs. In your position as the Assistant Dean for PhD programs, you're in a position to encourage women to enter the career in science or medicine or other health professions. And we do see a lot of applicants, female applicants at this level, but how do we encourage them to actually continue in careers in science and medicine? Because oftentimes we hear this takes a lot of time. I want to think about having a family. I want to think about other pursuits in my life. How do you start that conversation?
I think that's a wonderful question. Thank you so much. Especially a lot of us here are women who are also researchers, right? So I think it's important to set a good example by your own action, is to show what can you do, what you can achieve, and how you can do that effectively. So by mentoring students early on in their career, by teaching them how to prioritize your tasks, how to prioritize your research, how to take time, for your research is very important. I also think that recognizing the special challenges that young women have to go through, especially when creating a family, and accommodating them for them is so important. And I know your office has created a lot of initiatives to help young women, young PhD students who are starting the family by creating maternity leave policy. It's so important, right? There's so much of underestimated how much is needed for young women who are trying to start the family in the workplace. And often they're forced to choose either career or family. So creating these accommodations is so important. So I think that, you know, having a conversation with them, what are you expecting? What are your needs is also so important to listen, to accommodate, and to set an example. So I think these are the most important aspects.
Thank you. And a question to our panelists, many of you have experienced that in your careers. So what have you done to integrate family and career, especially your very intensive careers? Maybe some of you can speak to that. Some personal examples that can be beneficial to our audience.
I can make a comment. I don't know how beneficial it is, but I remember growing up, you know, the commercial, Angeli commercial, I can bring home the bacon, fry it up in a pan, and never let you forget you're a man. So I think many women have this idea that they have to do everything at the same time. But I think changing the mindset to say you can actually have it all, but not necessarily at the same time. So in any given time, having, as Dr. Chairs mentioned, those priorities in mind and saying, what is it that's important to me this year? It's not necessarily going to be the same thing that's important next year, but I don't have to do everything all at the same time. So, okay, maybe my career takes a back burner for a little while here. Maybe the family takes a little bit less time here because of the different needs. But I think being purposeful, intentional, and thoughtful about it, and then you can have a very successful professional life and a very successful family life.
Yeah, that's a very good point. Yes, Dr. Kessler.
So I completely agree with Dr. Ludmer, which is usually the case. And I would also say that one of the things that I believe everyone on this panel also brings is trying to make sure that we're very deliberate about how we message that to the individuals who we mentor. And so rather than talking about the obstacles that students will face as they're thinking about the next stages in their career, just having them really think deliberately and doing a decision balance about what's important about that time and that you can be successful, but it may not be as quickly as you might have anticipated, but don't exclude the possibilities because you're so anxious about it.
Oh, that's a very good point.
I have another thing that I think is very important in doing all these things is being strategic. And not only being strategic, but looking for synergies, you know? So everything isn't isolated, but you can do several things and you can really make a difference at the same time. I don't want to hog the mic, but I'm happy to give people who want to reach out to me several examples of what I just said.
Yes, Dr. Lakeith.
So by the color of my mask, I've never had to worry about the man part. I do recommend that all women have a wife. But what I really mean about that is I think it's a partnership at work with your colleagues. It's a partnership at home, communicating. So if there's a priority at work, you're communicating that at home and not trying to do both. Similarly, if there's something going on at home, you need to talk to your team and say, look, this is a really big part of my life right now. Can I be a little bit more of a follower and not so much of the leader until this gets resolved?
Absolutely.
I'd also like to say anybody who knows me knows that I carve out time for my family. So for example, a Sunday dinner in my life is, it's no, you know, there's no crossing that, right? So nothing takes more importance than Sunday dinner in my family. And so carving out that time, making those appointments for your family that are as important as any appointments that you have at work, I think also goes a long way.
Absolutely. I want to go back and talk a little bit about that very important part that we'll do, which is education. And I want to ask you, Dr. Ludmer, in your role for curriculum integration in the School of Medicine, we hear a lot about the missing parts of curriculum. So I think Dr. Etienne gives a very good lecture about the racial imbalance and how we deliver education to our students. But there's also that gender imbalance where we don't cover the health of women to as much extent as you know, the typical male dummy that we all show examples on. I'm sure that skeleton is male. Yes. So how do you ensure that, you know, the curriculum is balanced and that the needs of women and women's health has the same priority?
Yeah, I think that's a fantastic question. We did a lot of this work over the past few years, really. It started a few years ago when we appointed somebody to actually be in charge of a women's health thread and really start looking very early in the curriculum, where were the opportunities and where could the partnerships happen in the different basic science courses to really bring more attention to women's health. But even beyond that, when with the work of the Anti-Racism, Anti-Bias, Health and Equities Task Force and Steering Committee, we took a deep dive into the curriculum to really identify the gaps and again, see where the opportunities were. But similar to what was said in the first panel, actually we really needed to get all the stakeholders involved, really communicate, really build bridges and present this as opportunities, not just as challenges. And as we got more people involved, I think we also got more excitement to really make sure that we are paying the attention that we need to these topics in the curriculum.
Thank you. And I want to have a follow-up question to Dr. Ponterio, because you, and we just had match day, right? So that's a very important step in every physician's life, right? But we do know about the imbalances in different medical specialties. So how do you encourage your students to apply to these specialties that are notoriously male dominated?
Yeah, so I mean, that's, and you said the most important words, I think, which were guide and encourage.
Yeah.
So, and that forms really the basis of the advising. And it starts way before the residency application process. I think it starts as early as possible, as soon as the students matriculate, even sometimes before they matriculate. As you know, this year we had a pre-matriculation program where we did an initial orientation and actually a workshop about career advising, and try to break some of those stereotypes that we have for some of the more competitive specialties. So, you know, it's a longitudinal process, I think, of advising. It starts, you know, kind of in parallel with the academic advising, just mostly to introduce the students, you know, female as well as male students, to as many of the specialties that we can. In fact, we've started a new effort now to kind of follow the curriculum with the students, so that when they're being introduced to cardiology, let's say, in the curriculum, and the heart as an organ, that we bring in cardiologists at the same time to speak to the students about how they have reached the path, the position that they have currently. And in even choosing those people that come to talk, I've tried to incorporate as many New York Medical College alumni into that program, and not just the ones that are local on campus that sometimes the students get, you know, a lot of exposure to over the course of their time here, but ones that have actually moved outside of New York Medical College and have established their career at other locations. We just had a nephrologist, Alice Sheridan, who's a 1986 alumni, talked to our students just yesterday. She's a nephrologist at the Brigham. She started out right here. She did her residency there, and she is not only a practicing nephrologist, but an academician. So she, a researcher. So she, you know, she spoke to the students, and the first comment afterwards was like, wow, it's so wonderful to see that, New York Medical College is outside of New York even, so exposure, I think, is very important. And of course, the mentoring itself is establishing mentors, creating what we call a brain trust of mentors, right? So that it's not only the vertical mentors to say, oh, who can I aspire to be, but also the horizontal mentors. And those peer mentors that you have to have first before you actually go to the vertical mentors. And then vertical mentors, you can have various little branches of that. You can have the person you want to kind of be like, and then you can have the career person, mentor that you want to aspire to. And then I always say we also have the vertical mentor of the patient, right? So that we can learn so much from our patients, the different types of patients that we have in practice, that helps us along the way. I also come from the GME world, the graduate medical education world. So I think that I try to bring into the student advising is I kind of know the other side as to what the program directors are looking for. And so I try to bring that to the students as well.
Thank you. And I want to continue this thread about mentorship. Dr. Lucchese, I actually hear a lot about you when I travel to scientific conferences because people come up to me and say, she was my mentor. So I think your official position here is an official mentor, right? You're Associate Dean for Faculty Development, but also you mentor a lot in your spare time and as part of your career. So can you tell us about some of the important lessons in mentorship, but also in being mentored?
I think the first thing about mentoring is to try to find someone that understands your experience, which may be a barrier that others don't know about. For me, my most significant barrier was being a first generation to college student. Blue collar family, no one ever gone to college. I didn't know the process. I didn't know what to expect. So it never occurred to me that I couldn't do cardiology research because why not? No one went to college in my family, so why can't I do it? But I think when choosing a mentor, you have to, I heard from the previous panel and from our panelists here, finding someone who has that servant mentality, because a good servant leader wants to lift you up and they worry or care about you almost as much as their own career and the politics and all of the things that happen in their position. So I urge faculty and students is to listen carefully to what they say, but more importantly, watch what they do. And you find the people that have those types of servant leadership in action. And I think everyone here on the panel, the past panel and the next panel are potential mentors in that category. I'm also going to give a shout out to Dr. Kara Grimes, who's in Eurogyne, that's all I know. But when I went to their retreat, what I noticed without her saying anything was her faculty were going, she has this like 5-year plan that she helps us with. It's individualized. She gets us networking. She also protects us from too much work and too much service. And she talks us up to the boss. And I'm thinking, when you look for kind of mentors, that's the kind of person you want to mentor, someone who's going to have your back, protect you a little bit, but also encourage you and push you and get outside your boundaries so you can achieve your own personal goals. I think a mentorship lasts forever. I just heard from someone who was a student in 1994. He's like, I need your help on something. Could you give me a call back? And I think that developing that mentoring relationship can be that longitudinal where 20 years later or 25 years later, they're still calling you saying, oh, I need help. And that to me as a scientist, as an academic, when I end my career, I want it to be by the mentoring relationships, not by the number of papers that I publish. And Dr. Etienne, I have a challenge for you. I love the rich history of women at this college. It's time to update the history. Everybody here, everybody on the last panel, these are the women leaders. We don't have to go back to 1910 to find leaders at New York Medical College. So I hope moving forward, some of the people that are on these panels, some of our unsung heroes, are going to become those people on the poster board because it's time.
Thank you, Dr. Sasik.
That's a very important point, right? So our role models don't have to be from many years ago. We are surrounded by role models that we can look up to. And speaking about going outside of your comfort zone, I think that was mentioned several times. Dr. Ansel, you direct the applied practical experience for the MPH program, which is literally going outside of your comfort zone and trying something new that makes a difference. Can you tell us how you work with women who are maybe afraid to do that?
Sure, absolutely. I've done a tremendous amount of work in the community through the applied practice experience, through our Children's Environmental Health Center at the Hudson Valley, through our Pediatric Environmental Medical Service. With all of these programs, and that's newly created by our Dean Ambler, all these programs, we reach out to women. We reach out to women of need. We reach out to we're as inclusive and diverse as possible. We work with underrepresented populations. We are out in the community. We are connectors. I consider myself a connector to the faith-based community and to New York Medical College in everything that we do. Our practical program has over 800 sites. I think my eyes are terrible, but I think our Commissioner Ambler is in the audience right now. I think. But yes, you know, we have done incredible projects. I could go on make a presentation for an hour about the work that we've done in our School of Health Sciences and Practice in really empowering women and underserved minorities, people at a disadvantage, by doing something, by applied action. Thank you.
Thank you. And we should take note of your, that you volunteered to give this lecture. Because so now I want to sort of open this up to discussion for the panel. We heard a lot of different threads here about mentorship and leadership and really supporting and elevating women around us. So the ones that come after us can have an easier path forward. So what is the one lesson that you learned in your career that you really want to convey to the next generation? I'm sure you have.
I think for me, when someone tells me you can't do that, my answer is shut up and watch me. And I think sometimes, you know, you hear that for whatever reason. You're this, you're that, you can't do this, you can't do that. And I've always said, don't give in to that. I had a student just recently said, I want to go back to India and start a clinic. And my friends laughed at me. And my simple question to him was, well, if you don't do it, who's going to? So I think you will hear that in your career, no matter who you are, but don't give into it. Listen to them and just, in a very nice way, say, thank you, watch me.
Yeah, Dr. Chairs.
I think important lesson I learned is don't be afraid to ask for help. Yes. The collaborations are so important, and especially when you're in a leadership position, you might be apprehensive about asking for help, but it's so important to get that advice when it's needed. So I think that's a good advice to follow.
Absolutely. Asking for help is not a sign of weakness. It's a sign of strength because feedback is your friend.
Right? Yeah, I was just going to say that I tell the students that's my favorite four-letter word is help. And as an obstetrician gynecologist, we learned that very, very early on. You know, working as a team comes naturally to us. But we know that the first thing that we should do when we walk into a room after we assess the situation is call for help. And so I very much agree that I very much agree with Pam about the can-do attitude. That's first, but there's also part I can't do this and I have to ask for help.
Yeah. one four-letter word that I never want to hear from an OBGYN is push.
Well, you came to the wrong person.
Dr. Ludmer.
I know push in every language.
We might challenge you to that. I think I want to hear those.
What a philosophical question.
I think it's very hard to have just one. I think two things I want to say. Again, from the first panel about leadership development is to always develop yourself as a leader and recognize your gaps and always continue to learn about leadership. But I think the bigger thing, you know, if there's one sort of take home word value, I think is curiosity. And if we can all maintain a sense of curiosity in every way, it's not just about knowledge, but it's even when you're dealing with somebody and you're in a difficult situation, stepping back and being curious, what is it that's really going on here? Being curious, what is that person's perspective? Being curious, how did I contribute to this situation? Being curious, what could I do better next time? So always having that sort of questioning mindset so that you're never set in this is the right way, this is the only way, this is how it has to be, I can't do this, I can do that. Always questioning yourself and being curious.
I think another important thing that I would say to all our students as you learn is, and as you experience, what's not there? What's missing? What are the gaps? What can I do to make it better? How can I innovate? So think creatively. Learn, but be creative and don't be afraid to innovate.
Absolutely.
I got some great advice from a mentor. He said, you know, Pam, when you start out in your career, it's about success, establishing your lab, getting the grants, getting the manuscripts. But he said, that's about you. And he said, impact is what you do for others. And he said, a good leader isn't necessarily about personal success. It's about impact on their department, their institution, their university. And it hit home to me when I was at Nationwide Children's Hospital, the heart center that I was a part of. I was director of research. We were 5th in the country. We were like psyched. We got to go to Sonoma Valley. But the infant mortality rate in Columbus, Ohio was one of the highest in the country. So I'm thinking success of the hospital, but we're not serving our patients. So that success impact became an important example. And I think going through, you got to think about your own life. Is it about you or is it about impact? You can have both, but don't forget the impact part. And that's what I'm hearing Dr. Ansel say. She's a connector. What a lovely word.
Yeah, I love that. I really take to heart that the notion that your success and your impact is measured in the number of people that you mentored. I remember a few years ago, I was at a conference in China and they took me to the pagoda forest, and the pagodas are all different height. And the number of tiers depends on how many students you train. So if you have a really tall one, that means that you trained a lot of students. And I really wish that we had something like that, but for, you know, academic science and academic medicine, where your value is measured in how many students you really train. Any questions from the panel? Yes, Dr. Solomon.
Actually, that actually brings up a good segue into my question. And that is that I think that a lot of leaders have a bigger impact than just manuscripts or research funding. And so I'm just wondering, I guess this question would be mostly for Dr. Sponknagel, but maybe Dr. Schwartzman, who's also on the call. How is faculty productivity and faculty promotion being looked at in terms of recognizing the impacts of leadership in mentorship in clinical and academic ways other than straight published manuscripts and research productivity? And has there been any look at how promotion varies based on gender or race at New York Medical College?
Michael, are you still there? Michael and I, Dr. Schwartzman and I work very very closely on this. And thank you for that question. The definition of faculty and what we measure as far as credits for academic promotion or rank promotion is very much anchored in tradition. It's changing, and it's influenced by the culture of where you are. And the culture of New York Medical College, in my view, and as compared to many other institutions, I think is slowly starting to come from a very traditional sense, is retaining some of its really old traditions of what I would say nowadays is a bit of wellness. We don't have an up or out policy here, which means that if you don't go up to your next rank ladder in a certain amount of time, you don't have a job. So many institutions have that baked into their promotions policies. We do not have that. And I think that actually provides some wellness to our faculty, taking the pressure and stress off. But the kinds of things that you talk about, Dr. Solomon, Michaela and I were very busy looking and redefining our criteria for rank promotion. That was one of the first things that we did together collaboratively with the TAP committee as well as the faculty, to take out all of our pathways, all of our definitions, and we kind of tore it up and talked about it and looked across the country and looked at what our own values were, which you heard earlier today. And we created a whole new, what I believe is a comprehensive list and examples of metrics and criteria that get you credit for rank promotion. And those include things like mentoring and leadership and the kinds of things that go outside of the typical traditional scholarly publications. We know, particularly from the COVID pandemic, how many women with families were really sidelined through this pandemic, losing traction in rank ladder promotions because they weren't able to crank out papers, which is a measure at most institutions as one of the main things you need to do. So I'd like to believe that our TAP committee and our institution, the dean and the faculty have adopted criteria and measures that are inclusive and allow our faculty to, no matter what their interest, to get where they want to be. Michaela, do you have anything to add to that?
Yes, I just want to add that we also created pathways that were not before. And by doing that, we really increase the inclusiveness for promotion at New York Medical College. So this was really a big change from the previous system. It didn't change the bylaw, didn't change the essential policy of New York Medical College, but it opened a much broader horizon and much more opportunities for faculty to be promoted on different levels. Yes. We have now 5 pathways. We didn't have it before.
Yes, so the pathway she mentioned. Criteria. Yes, an educator pathway, which is brand new, as well as a clinical pathway. But we're not done. So to answer the second part of your question, Dr. Solomon, is what are the metrics? I can't spit them out for you right now, but they will be made available to the faculty. We report on these for the LCME, which is some of our upcoming work. And we're not afraid to adopt and adapt and tweak these pathways in order to have the progress and the results that we're looking for. So thank you.
Thank you, Dr. Spanknevel. Thank you, Dr. Schwartzman. This is actually a very important point that we don't have a 10-year clock, because studies have shown that when you do have a 10-year clock and allow extension because of, say, maternity or paternity leave, men always benefit because that gives them extra time to publish papers, and do work, whereas women actually do have to take care of the children. So it actually adds to the problem of equity. So thank you for that.
Yeah, and Dr. Etienne speaking. Yeah, and the other thing I'd say, just based on what Dr. Spunk-Nabel and Dr. Schwartzman just said, is, you know, the title of this overall forum is Knocking Down Barriers, and what they've just described was a way of knocking barriers out of the way of a lot of people who may have had difficulty to get promoted. And the promotion is important because there are certain positions that if you're applying for, like to be the chair of a department, you're supposed to be at a certain level of academic rank. So by knocking those barriers down, you're actually opening up, like they just said, opportunities for a lot of people. So it's great and encouraging to hear these wonderful developments. I did have a question. So I'll just, and thanks for that great question. I'm impressed with the answer. The question I was gonna ask, I think everyone here has talked a bit about the importance of mentorship and getting to where they're going. And I think a few of you talked about people telling you, no, you can't do something, and that you've still done it, you know, you want to do it anyway. I know a lot of our med students, particularly a lot of sometimes female students, sometimes marginalized students, are told that, you know, they say, oh, I want to go into urology, or I want to go into orthopedics, I want to go into usually a lot of the surgical specialties. And they get the answer, no, you can't do that. You're going to be, you know, and somebody will tell them their priorities. Not asking them their priorities, but don't you want to do this? Don't you want to do that? And then really kind of almost closing the door on them. And I just wanted to hear a little bit, definitely from Dr. Spunk-Nabel, since she definitely knocked that barrier down. But I also want to hear from other folks, like when people say, no, you can't be a surgeon, no, you can't be a chair, no, you can't be a dean, no, you can't be any of those things. What is the way do you bounce back? And let's say that student just happened to have just failed the test. They're already in a vulnerable place now. And somebody now says no, it really feels like a no. And then that imposter syndrome might seep in there. So how do you navigate that? And what advice do you have for any of the students who might be listening in, or folks who are still, you know, probably somebody right now is being told no on the wards?
Want me to go first?
I can, I'm ready.
At the risk of being a mic hog. So I think a great protectant against someone saying no is to know yourself. So Dr. Etienne mentioned breaking down barriers. For me, a great title would have been breaking down your own barriers, because you will fail and you will have hurdles. Everybody does. Women, men, you know, at every iteration of a human being, we all have barriers. We all have troubles. I think the most important thing is to know your own self, to know your own barriers, to know where you get in your own way. And if you want to do something and it's your passion and it resonates with your soul and how you want to spend your life, there's no amount of no's that are going to stop you from keeping that truth. So knowing your own truth, I think, is the best remedy.
And I think that's very important, just to understand yourself first, which is the first, you know, part of advising students, is they actually do assessments to kind of get to know themselves. And I think the next step of that is, you know, everything isn't for everybody too. I mean, so you have to, again, know yourself, and then your mentor has to guide you through that. And it's not just one mentor. So it's, you know, the brain trust of mentors, your friends and your colleagues can also be your mentors. They can push you sometimes more than you can push yourself. And don't ever forget, I'm going to go back to family. Don't ever forget your family, because someone, your family, your partner, your friends, those were the people who were there for you from the beginning. They know what you can do. they know how to push you, and let them push you, so that you go into that room. I remember when I started as an attending, my first day as first time at a hospital, and I was put on a committee, the executive committee. I didn't know why I was put on the executive committee. I was just a day one attending, but then I realized when I walked into the room why I was put on that committee. I was tokenized as the only woman in the room. And quite frankly, I had couldn't remember a time when I was the only woman in the room. I wasn't the only woman in the room at home. I certainly wasn't the only woman at the Sophie Davis program. I wasn't the only woman at New York Medical College ever. But somehow, I was thrown into this situation where I was the only woman on the executive committee. So I didn't get much kind of mentorship from within, but I did once I walked out of that first meeting and got my kind of power pose to bring in to the next meeting. And then once you succeed, the power builds. It's like, it's like a snowball effect. And so you have to get the people, you have to understand yourself, as Dr. Sponknebel said, you have to push yourself, and you have to get help.
I'd also like to add, in the School of Health Sciences and Practice, particularly with the public health students, I found it's really helpful to them when I come up with an action plan. When I've learned and I've taught in the School of Medicine, particularly family and preventive medicine, we teach about the 24-hour diet, the recall, what is your life like, what do you eat? Well, I've been practicing that with many of our students who are having a hard time. They're at the brink of failure. And I will get a 24-hour, 48-hour recall, and I'll find out what their life is like. And I'll try to build on that because they need concrete action strategies. So I will come up with times like, this is when you could use your time. Oh, you can get up early in the morning, and maybe before all the kids get up and you're going to work, you can get an hour in. So I found these types of action plans to give them concrete steps, and then to check in with them and to set up a weekly call and to let them know, look, if I got my cell phone with me all the times, it's PRN, if you need me, it's with me. Just send me an email, and let me know what's going on, because it's that being there and it's breaking it down to those concrete action steps that I found to be very helpful over the many years.
Thank you, Dr. Ansel. That's actually important. I think about failure a lot, and we often hear you can't fail if you don't try, but sometimes failing is really hard. And a lot of people don't have the social or economic support to actually weather through failure. So it's important to have a plan that allows you to deal with that. Any questions for the audience? Yes.
Hi, my name is Anita. I actually graduated from New York Med a couple of years ago in 2019. And my sister is, I think, about to start at New York Medical College in the fall. I just wanted to, mostly a comment. This last question about the imposter syndrome and about how to push through like self-doubt has really resonated with me, and I really appreciate everything you guys have said. And I think Dr. Etienne stole my question, because I was going to ask, as women in leadership positions, I'm sure many of you have, or maybe not, dealt with imposter syndrome, and how have you kind of pushed that mentality out of the way so you could kind of move forward with what your goals are and not let those doubts and kind of obstacles get in the way of your success? So I guess if anyone has anything to comment on that.
I can start on that. Thank you. And I think a lot of it has to do with what Dr. Lucchese said, where it's important to be in your own head and thinking, okay, someone maybe told me I can't do it, but in my brain, I can. So I'm going to do it. I think the thing is, we all have have symptoms of complex imposter syndrome all the time. Anytime any of us do something new, Yeah. We've never done it before. So of course we're going to have doubt. So accepting that the imposter syndrome, imposter complex is going to be there. It doesn't mean you have to just like ignore it, pretend it's not there, but just accept it and say, yeah, I have those doubts, but that also means I'm on the right track because I'm doing something new and I'm challenging myself. And so I'm going to really learn from this experience by pushing through it, even though that imposter syndrome is there. So I think the biggest piece of advice is to say, just accept, we all have it. It's going to be there. It doesn't mean don't do it. It means here's an opportunity for massive growth. If you actually take that and say, I'm going to do it anyway, and I'm going to make sure I learn from this experience.
You know, and I think for students, just us admitting, the leaders, the professors say, you know, yep, got it, did it, still have it. You know, admitting that yes, anxiety exists in my life and Paxil is my best friend. You know, I think though sometimes students are afraid. Yeah. They're afraid because they think they're the only one. Or you're a young faculty member and you're like, oh my God, what have I got myself into? They're going to finally find out that I don't know what the hell I'm doing. The first grant that gets rejected, the first patient you misdiagnose, you know, the first paper that gets rejected, and you're thinking, see, look, I knew it all along, but then you go to your friends. And if you can't say to yourself, yeah, but you did this well, and you did that well, you need that 24-hour friend, and risk of being a cliche, you need a person, your person. My person was a skinny Jewish guy from the Bronx that got me through grad school, because 24 hours a day, 7 days a week, if I needed David, I knew how to get a hold of him. And so I think finding that person that when you can't bring yourself up, you have someone that can. And I have to tell you, it's not your mother most of the time, because they think you're perfect. So, you know, I think you have to find someone who really knows you and knows your strengths and weaknesses.
I would just add that, and I agree with everything that's been said, you know, there's some misconception that there's one path to leadership, whatever it is. And I actually would advocate that sometimes you don't know where these opportunities are. And sometimes the most unexpected, it's not because you need to get to a certain rank before you get offered a position. Sometimes there just happens to be a position that falls into your lap. And don't be scared. It's okay to try something and then you try it. And if you need to make a change, you could do that as well. But accept those opportunities. And, you know, I would only amend a little bit what Pam had said in terms of the person and getting back to the people, because, you know, so often there is not one person who kind of checks off all the boxes. Sometimes you need to have some different perspectives because there may be different people for different things, and being open to just having that feedback and check yourself. And I think that is really an opportunity for growth.
Yes, I think listening to the feedback and being able to analyze it, not emotionally, but really analytically, not from what I'm feeling like, you know, even if it's negative feedback, it can feel so offensive and you can get so emotional about it and your reaction will not be the right one. But taking that constructively breaking it down and saying, okay, what can I do about these things? You know, taking this very constructively, I think this will help to improve you as in any position.
I could add one other thing about feedback, because we get so much feedback all the time. And I think it's important to think that feedback is one data point and it's one person's perspective. So it doesn't mean you have to internalize it. It doesn't mean it's right, but as what Dr. Chair said, think about it objectively, and it's one data point and it says a lot about what that person thinks. It's not always true. So you have to think about it for yourself and then decide what you're going to do with that feedback.
Thank you. And that's a very important point about going after opportunities. They have done studies that women only apply for a job if they meet 100% of the criteria that they specify. But men, you know, they meet 3, they apply for it. So I think you should judge yourself less harshly. and you know your self-worth and go after those opportunities, right?
So one of the things I'm also hearing from this panel, which I think you've kind of alluded to it a couple of times, and you all are very brave, but it's being brave enough to expose your vulnerability. Yes. I think kind of Dr. Kessler just kind of said it just now, but I want to make sure we emphasize that I think a lot of people are afraid of that, right? Of exposing those weaknesses and which is going to get in your way of asking for help, which we've heard a lot of people say. And I think Dr. Sputman started by saying, get out of your own way. So I think, just if you can briefly comment on that, anybody, about that vulnerability and how it's important to actually come to terms with it and be able to share it with whoever it is that's giving you that advice.
I'll start by saying I went through an unusual path to medical school. So I was in a 7-year medical program. So I was 17 applying to college and med school. And one of the interviewers, this would never be allowed now, but one of the interviewers said, why would you want to go be a doctor? Don't you want to have kids? At 17, you don't really have life experience, but I knew I wanted to be a doctor. And to me, that is what built up my motivation to continue and to be like, okay, just as Pam mentioned, you have to sort of take it as one person's opinion and know what you have with you and have that make you stronger.
I think I would add, I'm sure we all have stories like that of, how we got here, but I think in terms of the vulnerability piece, this also comes back to sort of the first session and the servant leadership, is that if we want all the people that we are out, say, leading in quotes, if we want to make a really open, inclusive, comfortable environment for everybody, we as leaders need to show that we are human. And we have to be humble and admit when we make mistakes, admit when we're overwhelmed so that other people can also do the same, can ask for help when they need it. If we don't model that for other people, it's going to be very hard for them to do the same thing. And that's going to ultimately impact the whole culture and the whole work environment. And that's something then that we are responsible for. So it really is our responsibility to show our vulnerability and ask for help when we need it. And I will tell you, I remember distinctly a meeting, a few months when COVID hit and everything it was very overwhelming. And I cried in a meeting that I was leading. And it was hard, but I did it. And to see the reactions and the support that I got as a result. And also everybody realizing, okay, she's really overwhelmed. She needs a little bit of help right now. And it didn't last for very long, but still, nobody got mad at me. I don't think anybody was talking about me behind my back afterwards, but it also just opened the door for everybody else to say, okay, things are hard right now.
I don't think I can follow up on that. That was really profound. I think we're right on time, right? Well, thank you very much. I'm really so pleased that all of you showed up in person, but I think Zoom ruined us all because you kind of unmute yourself in person by taking off your mask. But big round of applause to everyone. Thank you so much.
All right, well, thank you very much to that last panel, Dr. Holtz. That was a phenomenal experience. You did an excellent job of leading the discussion, and thanks to all the panelists for sharing so much about your journey and your path to getting where you are today, and also just sharing your vulnerabilities. I have up on the screen here the CME. So there's 3 CME credits for participating in this exercise. You can take a picture or go to there's a text, you can send a text message and get that. And again, everybody has there are no disclosures, no conflicts of interest in this session this afternoon. Before we go to our last panel, as promised, we have one more poster to present. We're going to have Alexandra Schultz will be presenting a poster on Dr. Morton. And Dr. Morton is the first and only woman who has served as president of New York Medical College.
Good afternoon. I'm Allie Schultz, a member of the class of 2023 at New York Medical College and a member of the Women in Medicine Initiative at NYMC. I'm here to unveil a poster honoring Dr. Kathleen Morton, the first woman to serve as president of New York Medical College, who had previously been the first female dean at the Johns Hopkins School of Medicine. After receiving an MD in England, Dr. Morton completed her postgraduate training in New York City and Seattle. In 1964, as a private practitioner in rural Washington state, she published the first case report of a successful treatment of twin transfusion syndrome. In 1969, she entered academic medicine as a professor at the University of California, Irvine, and 2 years later, she joined the faculty at Johns Hopkins. In 1975, she was named Dean of Primary Care Education, becoming Johns Hopkins' first female dean. During her deanship, she worked to address the primary care shortage by exposing students to more primary care training and expanding the range of clinical opportunities in both urban and rural communities. In the summer of 1977, Dr. Morton was recruited to become the president of New York Medical College during the final stages of its move from Manhattan to Westchester County. She was president of the college at the time of its affiliation with the Archdiocese of New York. Dr. Morton held this position until 1978 and went on to serve as deputy director of primary care at Montefiore Medical Center until her retirement in the late 1980s.
All right, thank you, Ali, for that nice history. We're moving now to our last panel. Thanks for, I know you all know what long haul means because we've got the long haul syndrome is running around the country. And we're at the last part of our conference for this afternoon. Our final panel is being moderated by Dr. Mary Leahy. She is the CEO of the Chief Executive Officer of Bon Secours Charity Health System. She has the distinction of having hired me about 10 years ago, lured me back home to Rockland County, having me leave active duty service. But Dr. Leahy's done an amazing job leading Bon Secours Charity Health System. And she will be moderating this next session. And the session is called Empowering Your Key Strengths. And this will consist of women who are executives in various forms associated with NYMC, WMC, but some of their leadership might be also outside of this network. Thank you.
Thank you. Thanks, Mel. And what a great move hiring you. It really was. Good afternoon, everyone. And first I want to say how happy I am to be here today, and the fact that I'm standing truly in the shadows of women who've done such great things. You all have so much to be proud of, and the conversations this afternoon have been phenomenal, so thank you for that. I'll start by introducing our panelists, and I'll start with Dr. Tracy Gardner. The Children's Village organization in Dobbs Ferry announced Tracy Gardner, MD, as the new medical director in 2019. She made history as the first woman and African-American to hold the position in the agency's 170-year history. Dr. Gardner is the current Chief Medical Officer for the Division of Immigration Services at the Children's Village. She was also the first woman and African-American to hold her other current positions as the Director of Community Engagement at New York Medical College and Medical Director for the Greenberg 11 Union Free School District in Dobbs Ferry. She received her degree, her undergraduate degree from Mount Holyoke, and she graduated from New York Medical College also. She is a fellow for the Center for Juvenile Justice Reform, which is part of Georgetown University's McCourt School of Public Policy. And she also has had numerous engagements, numerous publications. I mean, you were really, truly very impressive. And I thank you for being here today. Our next panelist is Dr. Shirlita Amler. She was appointed Commissioner of the Westchester County Department of Health in 2011. She is a licensed physician, registered nurse, and certified emergency manager with many years of public health experience at the federal, state, and local levels. She is an adjunct professor at New York Medical College here and a senior fellow in the Center for Disaster Medicine, which places a focus on the protection of children and other vulnerable populations during large-scale community disasters. She helped launch the center in 2005. She also helped lead the COVID response for Westchester during the pandemic since 2020, when some of the first cases arrived here in Westchester County. And I welcome you today also. And then finally is Dr. Renee Garrick, who is a practicing nephrologist with over 35 years of clinical experience. It's a little more than that, Renee, but we'll give it that. I don't want to give away She's also the Chief Medical Officer of WMC Health Network, which is the academic affiliate for New York Medical College, where she serves as Vice Dean. As the Chief Medical Officer, she oversees academic and GME affairs and quality, safety, and regulatory initiatives. She serves as the Associate Chair of the Quality Steering Committee of the Health Association of New York State. It is on the New York State Department of Health Quality Advisory Committee for Office-Based Surgery. Additionally, she is the co-chair of the National Quality Forum Renal Standing Committee and has served as a member on the NQF technical expert panels. So we've got a lot of really talented people here this afternoon. I'll also add that Dr. Garrick lives here in Westchester County. She is married and has her 2 adult children, but she was also my mentor when I went through the program here at Westchester Medical Center. So that's why I know it's more than 35 years. So
I knew you'd be that way.
Welcome to all 3 of you. So we're talking about empowering women, and we're talking about key strengths. And just a couple of little notes that I made, because there's so much to talk about and so much that we've written about this. But I'll just start off for a moment. The healthcare in the United States, right? Consumerism is driven by women making the decisions for healthcare for their families. 80% of those decisions of where we're going to spend our consumer dollar in healthcare is done by the women making the decision. They make all those choices. So, it's very, very high compared to other industries where men predominantly make the decisions. Women also represent over 70, even up to 75% of the healthcare workforce in the United States. Yet when it comes to leadership, only 25% of women reach leadership level. So there's a huge funnel for jobs and a very tiny neck for women to get down into the leadership roles. So we have to look at what are we doing and how can we change that narrative? So I'd start perhaps with Dr. Gardner with maybe some of your thoughts on how we can change that narrative and how we can bring women to the table.
Again, thank you for having me and thank you for the introduction. I think one of the things we have to consider is that what are you doing to increase your legacy? And your legacy means what are you doing to bring other people forward, right? So that you won't be here forever. And so when you're not, knowing that, what are you doing to make sure that there's someone behind you or alongside of you that is learning all the information? I did a talk recently and I said, it is, I'm happy and I'm humbled to be the first to have done many things, but am I really successful if I'm the last? Right? So my success is based on making sure that I open that door so that we're clear, there are no bootstraps. Somebody's got to open the door for you. You can have all of the skills you need, but if somebody doesn't open that door, then you don't get to walk through it. So it is our responsibility to make sure that we're door openers.
Okay, thank you. In healthcare also, again, with any C-suite, I would say that there are roles there that are, people enjoy those roles, and there are expectations set on the people that are filling those roles, whether they're men or women. Although I think, the approach to how a role gets filled certainly can be different, whether you're a woman or a man. And I think also the expectation of how that role gets filled. So I don't know, Dr. Garrick, if you want to speak to that a little bit.
Sure. So first, thank you, and thank you for the invitation. I think the journey to executive leadership for women is obviously different than it is for men, but I think Tracy hit it right on the nose. The issue is having the door open. And I think, at least, now that Mary Pat gave it away, I'm like old. So like in my generation, it was very, very common to be the only woman in the room. In fact, it was really uncommon not to be the only woman in the room. And part of the journey was learning how to find your way to effectively communicate with individuals who were different than I am, because they were all men. And their expectations and how they interfaced with women was different. certainly one of the other panelists gave an example about someone saying, why do you want to go to med school? I'll share with you that when I was interviewed for med school, I was asked during my interview, what makes you think you can be a good wife, a good mother, and a good physician? And being a ridiculous 1970-something kid, I said, the same thing that I guess made you think you could be a good husband, a good father, and a good physician. And he said to me, this is a true story. He said to me, young lady, this interview's over. And I said, okay. And I was so crazy at the time because I was this kid from the Midwest, but I went to the dean's office to complain about my med school interview. Because I just was so shocked that anyone would behave that way, because I grew up in a tiny town in Ohio with like 4,000 people. I'd never been on an airplane, never been anywhere. I had no idea that there was even a decorum that went with the world. So I think that my journey was probably truly fashioned by mentors for sure, but many of my mentors actually were men. And many of them were enormously helpful in having they would sit and suggest ways of approaching things. And I'll say that early on in my career, when I started going to meetings and going to society meetings, because I spent time doing that in addition to being a doctor, I spent a lot of time watching how other people communicated and learning how they ask questions of each other. Because there's a way to do it that doesn't put someone on the spot. There's a way to do it that doesn't raise people's anger. And I spent a lot of time watching that, and then took a lot of leadership courses because it's not something that any of us learned in med school. So I think to succeed in that world, you need to have a lot of situational awareness and pay a lot of attention to cues. As someone else said, you have to do it as a woman, you have to be right as a manager and right as a leader. You have to really pay attention to that feedback and expect that it's not always going to be a smooth sail. As certainly Shalita knows. Right.
So, again, great points. In your education by men, in your role in leadership, a man who shows that, they can be bright, they can be articulate, they have great ideas. Sometimes a woman in that role can be seen as aggressive or bossy, or, there are other words that are used. Dr. Amler, can you talk a little bit about that and how you kind of take a step back from that, or how do we not shy away from the challenge?
I think that's really a very difficult question to answer, and I think it's almost very individualized, depends on, the personality of the woman involved. But for me, I've always ended up in fields where I was almost the only woman. One of my early jobs, I was a sanitarian at a health department. I started out as a public health investigator doing sexually transmitted diseases. I was the only woman. And they razzed me and did things we can't even talk about here. But, I just thought, you're not getting rid of me. No matter what you do to me, you're not getting rid of me. And so then later I decided to become a sanitarian. And once again, I was the only woman in Northeast Arkansas in that role. And once again, I was harassed. And I thought, you're not getting rid of me. I don't care what you do. You're not getting rid of me. And then I remember deciding that I wanted to go to nursing school. And I went to talk to the dean of the School of Nursing, who happened to be a man. And after about 5 minutes, he looked at me and said, I don't think you'd make a very good nurse. And I cried all the way home. And I thought, you know what? You're not getting rid of me. So I became a nurse. And so I was a nurse, and then I decided to go to medical school. And luckily, by the time I got to medical school, since I was 36 years old when I went to medical school, I'm unlike most of the people here. It wasn't my first job. I think they had gotten used to the idea that there were women, but I remember talking to the dean at the college, because your college had to write a letter to the medical school, promoting you as an applicant. And the dean looked at me and he said, well, if you were only a nun. And I'm like, what does that have to do with anything? He said, well, they like unusual candidates. And I said, well, a 36-year-old mother of two must be fairly unusual. And I got in, so I guess it was. But anyway, I think the point being, you just can't give up. If it is your dream, you cannot let other people decide how you live your life. You just have to keep on that road, and you just have to say to yourself, they're not getting rid of me.
Yeah, great. Tracy, you have anything you want to add to that?
Oh yeah, I just totally agree. I mean, I cannot agree enough. It sort of brought to mind that I was once told, you know, your problem is that you have natural leadership ability. And so, and I was like, okay, I don't know when leadership became a problem, but I've been told I'm aggressive, I'm aggressive or whatever, and that's just, you know, ways to sort of deter you from your purpose. And so I very much, like Dr. Amler, was like, you cannot get rid of me. I mean, and so I think you will probably see some, I don't know how the rest of this hour, 45 minutes will go, but I will suspect there will probably be some common threads of those kinds of thought processes, of really just, you know, despite what people will say, like the other panelists said, you still have to continue to know who you are, what you want, and know thyself, and then be committed to that, even when you will have naysayers or dream killers.
Great. Renee?
So, I was thinking about what have been said by other panelists, and I think that one of the themes here is that no matter what anyone does in their career path, sort of the two guiding principles is you need to have a lot of integrity, and that means integrity for what you do towards others and integrity about how you view your own world. And something that's a little bit different, you need to be very honest. So, I mean, there are things that we're not that good at, and there are things where you absolutely should say to somebody else, I need help, and I need a partner. I need someone that get us through this, because we're not in this boat alone. And there's certainly, in the things that I do in the executive kind of world, that is much more the common way of approaching things than doing something on my own. It's very unusual that I do something all by myself. It's much, much more likely that I'm doing it with a whole team of people, because it's impossible to think that you have enough time in a day to get from A to Z, which is where you need to get, without making a team. And I think a big piece of what women are good at doing is having people understand that we all share in this, and we all share in the reward. And if things go well, I think many women tend to give the credit to others very easily. Mm-hmm. And I think that, well, some might feel that that's a weakness. Personally, for me, it seems that it's the way of making things work very harmoniously, and people deserve a lot of credit for what they do, because certainly when your team does well, it's because your team did a good job.
That's right.
It's not because anything you really did. It's really that your team did a great job, and we're thankful for that.
Yes, right.
Because they're the ones who did it. We might have helped lead it, but the hard work was done by your team. And I think women tend to acknowledge that readily. It's interesting, earlier comments were made about our home lives. I would have to ask my kids this. I was fascinated because people said they didn't take their work home. My kids have very much been a part of my work life. They know Dr. Leahy. They know who Mary Pat is, because when we were young together, I'd say, oh, I was on call today with Mary Pat, and here's what happened. And they didn't go into medicine, but they were part of this whole journey all along. I mean, they have not really, I've never been able to divide that work home world. I never really tried, to tell you the truth.
It's funny.
That could have been bad. So I don't want to be a role model.
No. Yeah, that's funny you say that, because I did. That's not my experience either. I have this very similar experience. I don't know that I divided them well, or I just rolled with it. However, I rolled with it. I also had 2 children in med school, so that was always part of sort of their experience. That is this world, and so I don't know that I did that. I don't think I did that. I mean. And it's okay. They're okay.
I remember someone once asked my oldest daughter, she said, so when you grow up, are you going to be a doctor like your mother? And she said, are you crazy? I don't want to work that hard.
Yeah.
So I think they, you know, they like to watch, but they didn't want any part of it. But what you said reminded me of one of my very favorite sayings, which is that there's no end to what you can accomplish as long as you're willing to let other people take the credit. And I think that's basically a very good tenet for a leader to have.
Mm-hmm.
I know I'm not the smartest person at the health department. I never claimed to be. What I am good at is surrounding myself with people who are smarter than me. And collectively as a team, we do a good job.
That's right.
Yeah. I was going to say, I saw this wonderful video in some leadership course I was taking, and that point was made by someone who was a Navy SEAL. But you know, it is not you. Your goal should never be to be the top dog. Your goal should be to be in the boat and helping to guide it like everybody else. And that is something I think, as training as doctors, it's really important because you know when you're used to the patient-physician relationship, there's a big difference between that interaction where they're really counting on you in the end to say, let's weigh these pros and cons together. Let's have some shared decision-making and come to a good answer. That's a very different relationship than a C-suite relationship.
Yeah.
And you're not the top, you don't want to be, you don't need to be, you need to be on the team, getting the boat to shore, not saying, do it my way.
That's right. Can I add, I went to, I don't know if you all saw this, but I went to the luncheon for the 50 most powerful women in New York City, Crane's top 50. And they had a panel, and one of the panelists said, you know, somebody asked her a question about her, you know, having a powerful role. And she said, I don't see myself as having a powerful role. I see what I do as being empowering, because I can't really do this role unless I'm empowering others. Because you cannot be an executive and be a micromanager. Like, you have to really put people around you that just have skills that you don't necessarily have and shouldn't have. You can't have all the skills. It can't be a monolithic team. Your team has to be diverse of skills and many other things. And I agree that you really do. It all is based on how you empower your team, how you allow your team to grow, right? Because the other piece is that you want to be somebody who's supportive of the growth of your team, even if it means they outgrow you.
I think that's one of the things I love most about my job is that I frequently have a lot of young women, but they're not all women, who come to me and want to talk about a career in medicine or nursing or disaster medicine. And I love being a mentor. And I think that they can see how much I love what I do and the passion that I have for it. And I think it excites some people. I know when I first came to Westchester as commissioner, my secretary, a darling, lovely girl, and she was so smart. And it's like, you know, do you want to be a secretary? Nothing wrong with being a secretary, but you're so smart. You seem so interested in what the nurses do. Maybe you want to be a nurse. And now she is one of the very best nurses we have at the health department. And I've had a lot of young ladies who've come to me wanting to, you know, thinking about medicine. And they all say the same thing. I don't think I'm smart enough. I'm not sure I can really do this, but this has been my dream. And I'm like, if I can be smart enough, honey, you got it. You know, you're gonna do just fine. And that's just something I really love about it. Love about the job.
That's great. That's a perfect lead in. Thank you. To the next point that I was trying to bring up is about how do we identify and how do we nurture that next generation of healthcare leaders that are women, and how do we empower them to get beyond that feeling of, you know, do I have the self-worth to do this, or the vulnerability that we talked about a little while ago? You know, how do we say it's okay to be vulnerable? It's okay to say, I'm not sure I know the answer right now, but I'll get back to you on it. So how do we do that, Tracy?
Nice. So I feel like you're asking more than one question.
I'm sorry.
I should ask two questions. So I'm going to answer both. One is, I think that one of the things about nurturing people is allowing them to be a part of the work that you do, right? You have to be available and accessible on some level, especially, and that comes when you have these sort of team conversations. So when you have those sort of team conversations, they get to see how you strategize, how you work through things, and how important their input is. The work that I do is extremely unique. I work in different big systems, immigration, child welfare, court system. So I am a physician that does something that is super unique that most other physicians or medical students don't ever get to see. So because of that, when people say, can I spend the day with you or whatever, I try to make myself within the constraints of my job available, or at least have conversations, because I do know that most people will never get the opportunity to see the kind of work that I do. So I think part of that is understanding that you're doing something unique, and that to allow some people in to do that. And then second of all, in regards to vulnerability, I think you have to say, I don't know. I think that's about integrity and honesty, is that when you don't know something, it's okay to say, I'm not sure, let me look it up. You can't, even as a physician, you can't possibly know everything. Everything's not in your head. So you got to say, I don't know. I mean, I think it makes you a good physician to your patients, to the people around you. When you say, I'm not sure about that, let me get back to you. And I think that's the form of vulnerability that results in what people see as integrity and honesty.
Renee?
Yeah, I actually think that that's such an important point. As you know, when you're training and you're being grilled on rounds, it's not really an expected answer to say to your attending, don't know, I'll get back to you. Yeah. But as you mature in your careers, it's critical to realize you don't have the answer at your fingertips, and a much, much better answer is to say, let me think about that. Let me get back to you. Let me ponder a little. I'm not sure right now what the best solution is, rather than just jumping to some quick answer. Because sometimes if you jump to that answer, it will be the wrong answer. And when you realize that, you're going to have to readjust all your steps. So that's a very different learning technique. And I don't know how others have done it, but because I wanted to do additional activity inside healthcare, in addition to taking care of patients, I did take a lot of leadership training and went to a lot of courses, because it's not something that necessarily people are exposed to in medical school. And I hate this expression, but you need a little different toolbox to be able to know how to handle very complicated situations, because you don't see that in medical school, and it's different training. But I do think it's important to be able to comfortably say, not sure, let me think about it and get back to you. We say it to patients all the time, but saying it to the CEO is sometimes a little more challenging, to tell you the truth, right?
I actually agree with that. When I was a third-year medical student, we had an attending who, when he was asking you questions, like to throw in a question about ancient Rome or Greece. And, I think he did it just so that you stood there with this stupid look on your face and said, I honestly don't know the answer to that question. And learning to say, I don't know the answer is probably the most important thing I learned from this gentleman. And so it's okay that you don't know everything, because nobody knows everything. And I think having a varied background makes you a better overall person. So, like I said, I didn't come to medicine straight from college. And my husband likes to kid me that when I worked for the health department, I had a Class C plumbing license. And so all these things, any piece of knowledge, any piece of knowledge you gain, no matter where you get it from, helps make you a better person. And for me, it's perfect. As Commissioner of Health, I don't just deal with medical issues. I deal with food issues and water issues and engineering issues and children with special needs problems, and a wide range, in addition to how do we deal with COVID and how do we manage this pandemic, and so there are medical issues, but there's a whole bunch of other things that I'm responsible for. And so having a little broader background works for my advantage. And so I think it doesn't matter where you're coming from, it's where you want to be. Where are you trying to get to? And everything you learned your whole life will only make you better when you get there.
Okay. Yeah. I'm going to pause for a second and see if there are any questions.
I definitely have one. Okay. So as I'm listening to, this is Dr. Etienne, as I'm listening to you all speak, one of the things that I started thinking about, a very impressive panel, is I would like it, I'm sure also the audience would like a peek into your brain of what was happening, what was going through your brain. I'm a neurologist also. When the pandemic a couple of years ago started gripping Westchester County. And based on your roles, people are going to be looking at you and saying, what are we going to do? I'm just curious to know, like, what went through your head, and while everybody's looking at you, what did you say? Did you just say, let me go figure it out, I'll come back to you? Or did you know, how did your leadership change, and what did you tap into to actually lead your various organizations through this pandemic?
I guess I'll go first. And I have to tell you, Mil, you were sort of in my head, because as Dr. Amler was talking, I literally started thinking about the pandemic as she was talking about, like, your toolbox. Well, I didn't have, pandemic, in my toolbox, you know what I mean? And so, but I had a responsibility. But I had a responsibility for a child welfare agency that had 1,500 employees and hundreds and thousands of children and families across this state. And so it's different when you're in a system that's not a healthcare centered system. So the problem is that the healthcare system hadn't thought about how it was going to impact foster care, how it was going to impact children who can't leave the campus, right? So we have the staff that have to stay, and we have the children who have to stay. So when COVID comes, what are we going to do? And what if you have staff who don't want to be here because the kids have COVID? And then what about children who are in foster families who, once the child has COVID, the foster family no longer wants to foster this child? So those were sort of the questions. And so one of the things I remember doing, I did a couple of things. One is know what you don't know. And I knew I didn't know how to do this yet. So, but I knew there was information out there. So I took a class at Harvard, like a crash course. Harvard had a class called How to Prevent the Next Pandemic, Lessons from Ebola. It was a set, right? And I was like, this seems like something that might be helpful. And so I took it. It was about a 7-week course. I took it in about 2 weeks because it was asynchronous. So I took that course so that I could put that in my toolbox and learn from what was already out there. And then I started reaching out to epidemiologists at the state and trying to say, listen, since you don't have any, because at that point, there wasn't any real guidance about congregate care for residential. People were thinking about nursing homes, but they weren't thinking about foster care. So I ended up having to build a policy for foster care for child welfare around COVID. And then I shared that nationally with other child welfare agencies.
So to be really blunt, the first thing I did, honestly, was call Shalita. So there were kind of 2 parts to my role. And one of the big parts was partnering with Shalita and the Department of Health, because we had this major hospital and lots of patients calling, and we were closing electives. So I think the first thing I did was actually twofold. One, and I know this will sound insane, but I'm a little bit of a World War II buff. And as it seemed that this was not going to end in like a week or 2 or 3 or 4, we sort of planned our world at the hospital a little bit like the landing at D-Day. And we had teams. And we got a big group together with a command center and said, okay, we have a lot of ground to cover. Let's start putting people in charge. And that's what we did. And we built teams with, tried to not silo them. And every day, 4 times a day, we had calls among the team and with Mary Pat and her group and with the Health Alliance group and with the Mid-Hudson group and with Shalita, because the county for us was amazingly important because they helped us with testing and with outreach and with tracing. So I think for me, what I did right away was figure out how to get an army. Because as soon as we realized this is not going to stop, it's getting worse, we realized we needed, we needed an army. And we had phenomenal people that had unbelievable talents, like the people who started the testing and the tent. And those guys were just genius how they organized it and did it. And then we got outside help to do testing. So that's what we did. I don't think I had any kind of roadmap. I think, we spent a lot of time talking to, I talked to Mary Pat and called and said, what are you guys doing today? How are you going to approach the next big wave? It's that kind of thing, like you wouldn't want to ever have to live through what we've lived through again. But honestly, if we make it through and can get through the exhaustion and what's clearly harmed healthcare, which is really real, which is the burnout and the loss of staff, which I hope some come back, but a lot won't. We will have, hopefully, we'll learn next steps, and hopefully we'll have learned and lessons learned that we can apply for the future. But it was a brutal experience. And I would really thank probably Mary Pat and Shalita. We did not work together much, but I can't tell you how many times I called Shalita and said, hey, what do you think? Yeah.
That was two-way street.
Yeah.
I think for me, I was very lucky in that before I came to New York, I was a medical officer at the Centers for Disease Control in Atlanta, Georgia. And they sent me to a week-long training at the FEMA. FEMA used to have a training center at Mount Weather. And that was a really intense, because you went there and you lived there for a week. And the event that we were training for was a pandemic. And so we had to, in real time, to try to deal with this. And I was selected as one of the group leaders. So I had my own team and I had to go before the camera and I had to try to figure out how we were going to manage the pandemic. And I did this for a week. And there were times when I went to bed and thinking, oh my God, did I make the right decision? And I couldn't sleep at night. I thought, wait a minute, this is just a drill. Why am I fretting? Go to sleep. It's nothing's wrong. And so then beyond that, when I came to New York, first I was commissioner of health in Putnam County. And Putnam, we applied for a grant from the state of New York to build a model for alternate care sites. And we were granted the grant. And so, we had to figure out if there was an epidemic, whatever we thought at the time, it was all the planning was around flu, what would you do if your hospitals were overrun? And so we had to plan, who would use besides nurses? How would we provide care if we couldn't provide care in a hospital? And so we actually worked with David Markison, who's at the Center for Disaster Medicine, and some other people at the state. And we came up with a whole like 100-page manual on how to do this. I don't know what the state did with it, but we read it. So, and then when I came to Westchester, one of the things that the state reached out to us and they said, would Westchester be willing to take the lead when there is a flu outbreak or norovirus outbreak in an assisted or independent living facilities? Would you guys manage that for the state? And we're like, sure. So we put together teams. So we had our nursing team and we had our environmental team, and the environmental people are really key because they're the glue that makes everything work. And so when there was an outbreak of norovirus or influenza at these facilities, we would send teams in and we would manage it. And we'd make sure that everybody if it was influenza, everybody got vaccinated. We've got line lists, we're doing all the things. And so when this came along, we knew what to do. We just didn't know how to do it on the scale of 1 million people. And so that was the issue, is how do you take what you've done in a very small set number and actualize that to 1 million people? And so luckily we had great partners like Westchester Medical Center and a lot of other people out there who came forward and really helped us, because I have a staff of about 200, 250 people at most. You can't vaccinate 1 million people 3 times, with that smaller group. And so without having people out there willing to help us, we wouldn't have been able to manage it. But so I felt like my whole career, I've been training for this moment and thinking it would never come, hoping it would never come. And I hope it never comes again. So I better retire quickly. Huh?
Talk about right place, right time, right?
Yeah.
Right person. Incredible. I remember, the end of 2019, just around New Year's Eve, hearing about a virus in China. I'm like, that's interesting. And then a few weeks later, I heard about, a couple of cases in Milan. I'm like, oh, we're in trouble. We are in big trouble. I better order more IV tubing. And that was really the first thing that came to mind. I was like, I don't know why IV tubing. So I was like, okay. So, and things rapidly devolved from there. Beginning of March, first it was here in Westchester, and, it came right across the bridge, or actually up the Garden State Parkway to us in Rockland County. And, we were for many, many weeks the hotspot of the United States for COVID right in Rockland County. And, you both used military references, really, that would, not that the CDC is, but, governmental references. And, the one thing that I really take away from all of this is the importance of community and collaboration, and really working together with your state and local and federal officials, but also the general community. It was interesting that just on Monday, I was at a meeting and there was a gentleman there. We were talking about some healthcare collaboration, and he said, you don't remember this, but in the beginning of the pandemic, and I was like, I remember, there was a radio show, and I was asked to be on the radio show. It was for 30,000 people that were listening, and it was a call in, and they asked questions about the pandemic and, what are we going to do and everything. And, I didn't have a heck of a lot of answers, but I was at least honest and said, we're in this together. We're going to try to figure this out. And he said, the amount of calmness that I gave to those 30,000 people, I'm like, well, then you don't know what was inside my head. Right. There was no calmness. But he said, you really helped people get through a day at a time. And I think that's, our big takeaway is that none of us did, maybe you did, pandemic 101, but really none of us had any true real life experience dealing with a pandemic and, across 1 million and many, many millions of people. But we figured it out. We figured out how to provide that care for so many people and saved, so many.
Yeah. I think the one training that I would encourage people to get if they ever want to be in a job similar to mine is media training, because, we don't have the ability to get to every single person, but the media does. Right. And believe it or not, we always think as doctors that the people listen to us. No, they listen to the media. Sure. And if you want people to do something, you need to have the media to motivate them. Sure. And quite honestly, I would tell you the most scary part for me in the last 2 years was when I had to be on 60 Minutes. Mm-hmm. And I thought, oh my goodness, if I mess up, the whole world is going to see it, And I was so scared, I thought I wouldn't be able to breathe. I actually thought I was going to faint on camera. I think that was the most frightened moment of the last 2 years for me. But having that opportunity to speak to the nation, to the country about COVID, I could never do that without them. Without that partnership, I could never reach that kind of an audience.
I think that's such an important piece. I think that we tend as healthcare professionals to be in this niche, but we cross other things, and I agree with you 100%. I had a radio background, So that helped a little bit, obviously, with my ability to, communicate. But because of my work with immigration, I had done some national media during 2018 during the separation policy. So because of that, like, you don't know how these things will sort of help you later. Like, you don't know, like, I wasn't thinking when I did that I would need that skill later, that, you know what I mean? And everyone's not going to be receptive when they're stressed out. I mean, the pandemic was pretty stressful and people were, right, it still is, right? We're still interpandemic. And there were people in other positions in other places and spaces that were stressing out. So you're also dealing with people at their highest stress levels. And so it really does require some communication skills that we don't always teach.
And if I could say one last thing on this topic, and that is, as physicians, we always want to have all the answers for everybody. They expect us to have the answers. Yeah. And so it's back to that third year professor teaching me to be able to say, I don't know the answer to. So important, because if you are in front of the camera and you are saying things to people and then they can't trust you because you didn't say the right thing, you lose all credibility. So in the early days of the pandemic, it was really important to say, this is what I know right now. I don't know everything about COVID. There's more that I don't know than I know. And what I'm saying to you right now is what I believe to be true at this moment. It could change in an hour. It could change in a day. And it did. Mm-hmm. And so we really had to be very careful how we phrased what we knew. Otherwise, the public would lose confidence in us and not believe anything we had to say. So I think that's a very important lesson, is, to always admit what you don't know, right, as well as tell people what you think you know.
Right. Managing that message, right?
Yeah, can I just add, and I'd be remiss to add this, is that there was another layer for me as a Black woman, that I had another subset of the population that was looking to me in this health field to be a representation of that community as well. And so, that was another layer by which I had to be, I had to be cognizant of, they were looking to how I maneuvered and how I spoke and how I communicated, how that population saw me as a person in a leadership role. I'm always aware of my intersectionality, because it just is, it's a fact. It doesn't, it's not good or bad, it just is. And so I think part of that is also, I had many conversations with various groups in the population because of my work in immigration. I did a lot of talks with Latino groups. I did a lot of talks with African-American groups. I did a lot of talk with religious groups. And so I think that, I think that was another big piece of it, is understanding who you represent. If you're a woman, you represent women, and I think that they see that. And that, I said, it's just what it was at the time.
Yeah, great point, Dr. Gardner. And it actually makes me think what Dr. Leahy had said in her comments about, it's a community, right? Yeah. And getting the community on board, especially when it comes to vaccines, everything else that was going on, and finding those trusted messengers, right? So people who are more like you, whether it's a religion, whether it's race, ethnicity, and a whole bunch of other things, they're gonna more likely trust those trusted messengers. That they've already, people who they trusted before the pandemic started. So if you didn't have my trust before the pandemic, then you're gonna have a hard time getting me to trust you in the middle of all this chaos. Because where were you before? Where were you last week or 2 weeks ago? And now all of a sudden you want me to do what you're telling me to do. So definitely I agree 100% that community engagement and having it before the pandemic, the better that foundation was there before, I think the better you end up doing. And definitely that intersectionality is extremely important.
I think it's also important to remember that you need to meet people where they need to be met.
That's right. That's
you
right.
can't expect, especially as a hospital or a healthcare organization, to say, we'll build it, they'll come. You need to be able to, particularly about the vaccine issues and things, you need to be able to go out into the community and talk to people, speak with people about how we can help, how, we're not here to tell you how to do it better. You tell us how to help you.
That's right. I think that was, I mean, obviously because of all of the barriers to vaccines around subsets of the population, that became a very much part of almost every town hall I did, right? Is that fear. And if I didn't say Tuskegee 1,000 times, because that became a lot of the conversations around fear that people had, and in history of some exploitation that happened in Puerto Rico, that we needed to talk about that. And so the history piece is important. And so those are conversations. You have to meet people where they are. And I would often ask them, well, tell me what your barrier is. I mean, people always say, I want you to come on and I want you to give this spiel about COVID. And I'd be like, okay, well, I don't know where they are. So I would give very minimal. And then I would say, tell me what your barriers, help me understand where you are. I think that's where, and that's true, not just of COVID, right?
Yeah,
that's just the
everything.
practice of medicine and everything else. Yeah.
Renee?
I don't think I have much to add, and it's very well stated. I think that hopefully this road to executive leadership for women is something that many more will do. And you can hear that there are lots of ways of approaching it, and there isn't one right path. You can hear all of us got here by different pathways, and it's a way to impact lots of lives at once. It's a wonderful thing because you can have an impact with a patient, which is terrific. You can be engaged in medical societies and have impact on all kinds of different levels. There's something about having a role in an organization that you can impact the community. And it's really it's a wonderful, I mean, medicine's a phenomenal career to begin with. You can't find a better career, but it's great because there's so many different paths, and a path in terms of executive leadership is one of many. And I think, we all kind of have those golden rings as we advance in our careers. And a big challenge is deciding you can't do everything, right? You can't take all those rings and say, I want to do this, 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 and this. You have to decide, like, with that little bit of self-awareness and integrity, which one do I resonate to? What makes me happy in the day? And then focus on those. And I think you can hear there are lots of different pathways that people can take. And you heard a lot of it this afternoon, because there are lots of different women engaged in lots of different parts of healthcare. And everyone found a pathway to do that. And you can hear how much sharing there is. It's a wonderful dynamic way of spending a life and bringing your kids and your work home with you.
Exactly. Right. That's great. Yeah.
Thank you very much. This was really awesome the entire afternoon. Thank you, Mel, for putting it together, and great discussion. Thank you.
Thank you. Oh, we're doing pictures. Okay, yeah, sure.
Thank you, Dr. Leahy, for leading that wonderful panel of women executives at WMC, NYMC. Thanks to all the moderators, Dr. Tracy Milligan, Dr. Marina Holtz, Dr. Mary Leahy, for leading us through a really amazing afternoon of hearing about leadership in various aspects of our network. Thanks to all the folks who showed up and supported this. Thanks to all the panelists. Absolutely amazing. I mean, really. Thanks to our crew here, Juan Castro and Michael Frankfurter, for all the IT support. Thanks to everybody who joined us via Zoom and in person. Great event. Happy Women's History Month, everyone. I'm glad we were able to get together and celebrate in this way. In person, next year we'll do something and it'll be even bigger, and hopefully in person. I know it's hard to leave Zoom. I know nobody wants to leave Zoom, but Zoom, I'm sure the Zoom stock is through the roof But thank you all. Have a good evening.